the young man's name is Gordo.
Gordo, I knew that.
And Gordo is over in the GLC
With our
setting
part?
up things, yeah.
So
I talked to Patty Garber, and I said, we just want to make sure that he returns it. I said, we'll be in the rooms here until 5. So she said, oh no, he'll return. So that's the best we can do.
I'm good with, and he will. I've worked with him before. He's really great, and I'm not concerned. I just thought it was already in my bag. When he took it, I didn't really have any idea. Okay, so we're good. They're in order.
Good afternoon. It is showtime, 12:30 sharp. So for those who I do not know, my name is Dr. Christine McCallum, and I have the pleasure of serving as the program chair and director of our doctorate in physical therapy program. So I welcome all of you to this last event for the DPT class of 2024. I'm just going to give you a little brief introduction of how this afternoon will go, and then we'll turn it over to the students. So the first few hours of this afternoon, you will hear from our class of 2024 about their final academic exercise. After this, we will have a break, and then we'll start back at 3 p.m. for our awards ceremony. And you can scan this QR code for the brochure for today's events. Some housekeeping items. The restrooms are on the other side of this wall, and if you need to get up and stretch during the next couple hours, please feel to do that. We ask that you please silence your phones for the afternoon, if you haven't already done that. And this event is being live streamed for those who are not able to attend with us in person, so we welcome you. Anybody who's out there, welcome to join us from afar. And so now I'm going to turn it over to Dr. Ryan Monty, who is the course coordinator for our service project.
Okay. So the first portion of our afternoon is the 2024 graduating class in the Doctor of Physical Therapy program's final capstone lecture. This lecture is titled Wellness Through Movement, Outcomes of the 2024 Interprofessional Community Clinic. This class has worked on preparing, organizing, and delivering the community clinic for over a year, which has served many of our community members. I now welcome the Walsh Doctor of Physical Therapy class of 2024. We'll start with our project managers, Christopher Byers and William Magda.
So, hello everyone. Just wanted to welcome you all again, all visitors, family, friends, everyone we have with us here today. So starting out here, just some brief introductions. My name is Bill Magda. I am the project manager for the clinical services side of the community clinic, and I was in charge of the clinical services team, the documentation team, the referral management team, and their strategic outcomes team. And overall, this project was a great opportunity for us to collaborate and work towards a common goal, that being to serve the greater Canton community and have a successful community clinic. I'll hand it over to Chris.
Thanks, Bill. All right, and then, like I said, my name is Chris Byers. I was the project manager for the operations management team, so it was a lot of the day of teams where we kind of worked through all the difficulties that came with managing clients and getting people through effectively. So my teams were game day functions, marketing, scheduling, and staff development.
So before we get underway here and talk about what the outcomes of our community clinic were, we have to think about, so what is community health overall? So what is the purpose of why we do the community clinic? And there's multiple different ways we can define community health. There's many schools of thought about it, but overall there's two main players that we want to keep in mind. One is the health status of a group of people, so just a general individual, people who are in a common location, such as Canton, and the actions that people take to preserve their health. These can be private actions, so like a person deciding to go to the gym and exercise, or a company taking a competition to see who can get the most steps in a given day. Or they can be public, such as like government projects and stuff like that. So then with community health, we gotta think about, so then what's health? Health itself is a state of complete physical, mental, and social well-being, and not merely the absence of disease. And based on this definition, we can see there's multiple things that play a role in optimizing the level of one's health across multiple domains. So staying close to home here, there's a few different projects that are local around here that promote community health. One being the Hoover Trail that runs right across the street here in Hoover Park, and it's a 5.4-mile trail sponsored by the Stark County Department of Parks and Recreation, so that's more of a government project. More of a private endeavor is opening like a grocery store. There's also Live Well Stark County, which promotes policies, systems, and environmental changes that support wellness. So they sponsor like a farmer's market here in the area, promoting healthy choices there. And additionally, there's Stark County Creating Healthy Communities, which promotes environmental changes, so like building parks, gyms, et cetera. We also want to think about how health is delivered amongst all the individuals in our community. So there's 3 tiers of how health interventions are given. First is primary prevention, so people who are healthy, and we're trying to prevent disease before it ever occurs. So taking preventative action, exercising, eating healthy, those are more primary prevention measures. Meanwhile, secondary prevention are aimed at early disease detection amongst individuals who appear healthy. So maybe someone who has early onset diabetes, they haven't necessarily like discovered that they have it yet, but they're still taking good actions to maintain their health. And tertiary prevention is more of reducing the impact of disease and any secondary complications amongst a symptomatic individual. So maybe someone who has a spinal cord injury, and we're trying to help them achieve the highest level of independence possible. When we think about this as my apologies. As we think about that as it relates with the role of physical therapy, generally physical therapy is seen as being delivered within that secondary and tertiary prevention range, so more individuals who already have an identified health condition and they are getting services after the fact, while the community clinic, which we worked to deliver more of a primary prevention, i.e. Preventing disease before it occurs in healthy people. This relates to like our current healthcare model. So typically an individual will develop a condition, let's say for example, diabetes, and then they go visit their primary care provider because they're feeling numbness and tingling and they're having some falls, and they'll go to physical therapy after the fact to help remediate that, and it's more of a reaction-based measure. Meanwhile, the prevention model that we want to promote, especially through the community clinic, was a condition prevention model, which an individual self-refers to physical therapy. The deficits are noted before they develop any condition, and then there's a plan that's established to prevent any adverse effects, such as a fall, which decreases disability and cost on the healthcare system overall. As we think as physical therapy in primary care, physical therapists have actually been primary care providers in the U.S. military for multiple decades, and soldiers visiting PT first are associated with lower prescription drug use, decreased ordering of radiologic studies, so like an X-ray, and increased return to work rate, so there are positive trends there. And there was another study that showed that administration of physical therapy within 90 days of low back pain associated with a savings of $2,736.23. So that's a nice chunk of change that people could use for something besides healthcare costs. So with all this in mind, I know it's a lot of information to kind of start out here, we want to think about how does this tie into what we did with the community clinic. There we go. So Stark County itself, the population is 372,657, with nearly 80% of the population being over the age of 18 years old, so there's a lot of adults here in the area. And about a fifth of the population reports that they're in poor to fair health, so there's a decent amount of people that we, are able to target and address through health prevention strategies. As we further consider Northeast Ohio as a whole, these are the top 5 health concerns as collected by SUMA Health in 2021. Cardiovascular diseases, both acute like a heart attack or chronic, are one of the top things, and exercise and eating healthy is one of those things that can help prevent further difficulty there. Mental health disorders, there is association with exercise decreasing the signs and symptoms of depression, so that's something to also keep in mind. With the opioid epidemic, pain management is another thing that physical therapy can help address. Chronic lower respiratory diseases and tobacco-related issues, as well as poor physical activity and eating habits. So these are all lifestyle things that physical therapists are in a well position to educate their clients and patients and help them to live better lives to avoid such health concerns. Additionally, right around 25% of our population, 26%, reports that they are physically inactive, so they're not exercising on a regular basis, while nearly 3/4 of the population has access to gyms and parks. So it's kind of why are some people inactive when we have a lot of access to these types of interventions? So just to highlight our need for the community clinic overall, with 79% of adults in Stark County being older than 18 years old, implementing healthy habits can decrease the healthcare costs across their age, whether they're 18, 35, 60, whatever the case may be. And 26% of adults reporting inactivity despite a majority having access to gyms and parks. We know that health education and physical activity referral can promote optimal outcomes, and this further touches on the domains below, nutrition, physical activity, and sleep. Physical therapists are in a good position to help educate individuals on these healthy habits to promote optimal health across the age continuum. From here, I'm going to hand it off to Chris to talk more about the community clinic itself.
All right, so as Bill said, I'm getting into more of what the community clinic was and kind of how we incorporated it, giving you a little intro before we move on to the individual teams. So the mission of the community clinic was to educate the students on treating patient populations. A lot of times it's these first-year students' first interaction with a patient or a client of any sort. We went through it as well, and it was just very beneficial to get that hands-on experience and interaction. And then for the vision of the community clinic, it's to help promote, as Bill was kind of getting at, the primary care model, so we can do preventative measures. We can do those annual health screens like sports physicals and things like that, as many healthcare providers do already. So 2010 was the first community clinic, and then in 2023 we experimented and added OT. So this year we just kind of built off that. It was the 14th annual community clinic, and we continue to try and work with OT to make it the most optimal experience for both professions as we did this. So just a quick overview of what the community clinic was. It's an annual cost-free screening, kind of like I said, like a physical. We go through a lot of different things that I'll touch on in a couple slides. With that, we tried to hit a lot of the population in Stark County, as that's where Walsh University is. And then it was run by Doctorate of Physical Therapy students, which is us, the DPT class, and then Masters of Occupational Therapy students, so OT. And then you'll probably see those a lot throughout the slideshow, so just for future reference. And then as we're performing this clinic, we're supervised by licensed PTs and OTs just to make sure we're following all the guidelines that we need to for this. So with this, we're just kind of looking at what is health and wellness and what did we do, or the first year students do, in their general screen. So they would take a detailed past medical history from all of the clients that were registered and that were coming into the clinic. With this, they would look at different domains of wellness. So some of the ones that we touched on were their emotional, physical, occupational, social, environmental, and if they divulged it, some financial aspects of wellness. So with that, we went through and made sure we screened out any red flags, so anything that might have indicated like cancer or any emergent medical condition. The first years were educated on that right before the community clinic on how to go about that, and then we helped them kind of incorporate that in. And then we go through screens of many different systems. So the cardiopulmonary system, we take blood pressure, heart rate, respiratory rate, just how they breathed. neurological, we would use like balance measures, so just kind of seeing how they move, as well as sensation and other things like that, and then reflexes. And then we would measure strength through, measure their musculoskeletal system through strength, sorry about that. And with that, we would just kind of get into outcome measures to finish it off. So there are 4 outcome measures we did, and they'll be touched on later by another one of the teams that comes up. But these really just looked at a person's balance, how fast they can walk, and then also their functional movement or functional mobility to make sure they didn't have any restrictions that might be limiting them in their daily lives. So then after they finished the PT eval, they went to OT, and OT looked at their quality of life, and they also measured grip strength in addition to what we did. All right, so then for marketing for the community clinic, we had this event. We had to get people to come in. So we had save the date postcards. We did a presentation at the local Y. I know that the marketing team worked really hard at trying to get flyers posted in church bulletins and just around the community to try and bring in those people that were interested in this free annual screen. And then they also were at the Walsh v. Malone men's basketball game to try and bring in some college students who may be a little more able to fill in the gaps where people that work weren't able to come in. So then the next was for referrals. So with referrals, we contacted previous referrals as well as adding some new referrals, and then you'll hear from the referral management team, but they tried to revamp the referral system this year, just try and make it more effective. And then they also helped educate us on how to make those referrals, and some of us third-year students had that experience through clinicals if we had to refer someone out, and it just helped provide like a holistic plan of care for this patient and get them the help they need. And then the referral management team was in charge of restocking those referrals if we ran low on any of the paper copies that we had. All right, so next we have just kind of the client pathway through a typical day in the community clinic. So it was actually in this room. We had it split up into 7 separate rooms with OT in the 7th room. So the clients would start and they would check in the Barrett lobby over here to your right, my left. With that, they would wait over there. The first-year student and the third-year student would get their medical history forms and go over that, make sure they covered everything that was necessary, made sure they picked out any of those red flag signs, like I said earlier, and just kind of organize themselves. And then they would bring the patient back when they were ready. So they'd come into the room, go through the eval, and then after they finished the eval in whatever room they were in, they would move over to OT, which was on the far left wall. And after that, they would finish with like a survey at the last table, just asking kind of how their experience was, asking things that we might be able to do better, and how we could continue to improve this clinic in future years. And then now I'll hand it over to staff development, which is led by Caitlin Crawford, and then she'll bring the rest of her team up as well.
I'm Caitlin Crawford, the staff development team lead, and I'm here with my team, Anna, Maria, Katie, and Gabe. In terms of the staff development responsibilities, these involved all mentorship aspects of the community clinic within first and third year student pairs. It was our aim to ensure that there was adequate preparation of DPT 1 students for the community clinic beyond the curriculum learned in the classroom, as well as preparation of DPT 3 students as clinical instructors. We developed a process to introduce the purpose of the community clinic to DPT 1 students. The staff development team presented to the first year students with an overview of the annual community clinic and outlined what DPT 1 students would be expected to do. They were also provided with a comprehensive reference packet serving as a guide outlining expectations, procedures, and important dates and documents. Mentorship plays such a large role in the physical therapy profession as a whole, whether relationships are formed with professors, clinical instructors, or peers. The staff development team collaborated to ensure that mentee-mentor pairs were carefully selected to best optimize the DPT student experiences. Pairs were selected based on a survey sent out to both classes consisting of professional and personal questions. Pairs were revised and then approved by our course faculty members. The staff development team was also responsible for organizing and leading class meetings between DPT-1 and DPT-3 cohorts. This included match day, where DPT-1 and DPT-3 students completed an activity to match with their mentee-mentor pairs, as well as a mock health and wellness screen that was also performed at a meeting between classes. I'm going to pass it off to Anna.
Okay, so additionally, we were responsible for leading meetings between both cohorts and providing a framework for making SMART goals. So the first-year students would have experience in measuring clinical performance. We facilitated communication between the DPT-1 and DPT-3 students during the spring semester while we were out on our last clinical rotation, and kind of like Caitlin touched on, we wanted to just make sure that we were nurturing and supporting these relationships because the mentor-mentee relationship is so important with the profession. We did this by creating a mentor-mentee accountability sheet, and this was for the DPT-3 students to fill out and kind of just keep track of progress of when they were meeting with their mentees. During the final week leading up to, oops, sorry, I guess you guys would like to see the slides. So during the final week leading up to the community clinic, the staff development team held a live mock screen for the first year students, and this allowed for them to get hands-on experience in performing a wellness screen prior to the community clinic, and it was with guided prompts from our staff development team. We also were responsible for organizing outcome measure documents, and these were needed to assess team functions, such as the ECI and STEPS tool. The ECI tool is a way to measure the DPT-3's performance as a mentor, and then the STEPS tool was used to assess the DPT-1 students as a professional, and that was filled out by both us and then themselves. And then lastly, we managed feedback between the two cohorts after each evaluation during the community clinic.
So our first goal is centered around our professional development objective. We wanted all of the DPT-3 students to meet with their DPT-1 mentee at least 3 times prior to the community clinic. This was measured via the accountability document where DPT-3 students filled out what date they met with their DPT-1 student and what method, in person or Zoom, and this goal was met at 100%. Our second goal was that 100% of DPT-3 students would assist their DPT-1 students in making their goals for the community clinic, and again, this was met at 100%. Next, we wanted at least 98% of the clients to report that their DPT students acted in a professional manner throughout the community clinic. This was a question on the post-client survey that all clients filled out at the end of their experience, and this goal was also met where 100% of the clients reported that all DPT students acted professionally. During the client evaluations, all clients had to perform 4 outcome measures, as Chris noted. Outcome measures are tools that physical therapists often use in practice to objectively assess a patient's status. Since outcome measures are so frequently used in practice, we wanted at least 80% of DPT-1 students to report improved confidence in their ability to perform the outcome measures following the community clinic. This goal was assessed via the post-clinic DPT-1 student survey, and 100% of the students reported that their confidence in performing outcome measures had improved. Also, in regard to outcome measures, we set a goal that at least 80% of DPT-3 students would report that their DPT-1 mentee was at least somewhat satisfactory in performing the outcome measures. This was assessed via the post-clinic DPT-3 survey, and again, 100% of the DPT-3 students reported their mentee was at least somewhat satisfactory. For our next two goals, we wanted to assess the DPT-1 students' ability to conduct a simple MSK screen. As Chris noted, all of the other systems were screened, but for the evaluation that the DPT-1 students did, majority of the screen was focused on the musculoskeletal system, and based on the DPT-1's didactic coursework, this is where they should be the most familiar with at this point, so that's why we picked this system for our goal. Our goal was that 75% of the DPT-1 students will report needing less than 50% of assistance during the screen, and this was met at 100%. We also wanted 75% of the DPT-3 students to report that their mentee required assistance less than 50% of the time. This goal was met at 91% of DPT-3 students reporting their mentee required minimal assistance. The STEPS tool is what Anna referred to earlier, and we wanted at least 70% of DPT-1 and DPT-3 students to report that the tool was user-friendly. This goal was also met as 90% of DPT-1 students and 97% of DPT-3 students reported it being user-friendly.
Our next two goals also utilize the STEPS tool. We wanted DPT-1 students and DPT-3 students to agree on the DPT-1 students' clinical performance using this tool. Our goals were set for the first years and the third years to be in agreement 80% of the time. Both of these goals were met as DPT-1s thought that they were in agreement 87% of the time, and DPT-3s thought that they were in agreement 91% of the time. This lower rating for first-year students compared to their third-year mentors was not shocking, as in the clinical education setting, students tend to rate themselves lower than their respective clinical instructors. For the remainder of our goals, we used the Evaluation of Clinical Instruction, or ECI tool, to evaluate. When incorporating the ECI tool, we wanted to set goals to highlight characteristics that we believe are important for third years to demonstrate as future clinical instructors. Our feedback goal is met as 100% of DPT-1s agreed that their mentor's feedback was both constructive and timely. Also, 100% of mentees agreed that their mentor demonstrated active listening throughout the clinic, which met our goal for active listening. Our communication goal is met as 100% of DPT-1s agreed that their mentor's communication was clear and concise. Also, 100% of mentees agreed that the responsibilities assigned by their third-year mentor were within their current knowledge and skill set, which met our goal for responsibilities. And lastly, 100% of DPT-1 students agreed that their mentors were positive role models, which met our final goal.
Okay, so I'm just going to give a little bit about some feedback we received from the first year students. We got our feedback just from some surveys, and this helps us just continuously revise the process of mentorship in order to make it better for both the clients and for our own teaching experiences for the students. So these were a couple quotes just from some surveys from first year students. General themes of it were a lot of the students enjoyed having a peer to kind of be able to call upon and ask any questions, and just having that kind of chain of command to go to. But they also appreciated having kind of the independence, but the support while they're there during their examination with any needs arising. So the community clinic provided a really good example for interprofessional communication and just abilities for us to work on these, just like we will in the field. We're going to be communicating with doctors, occupational therapists, supervisors, all kinds. So this really allowed us to work on just communicating between the faculty, the DPT-1 and 3 students, as well as with the occupational therapy students and some of the other classes as well. Just with things with conflict resolution, making sure all of the exams and everything were kind of on the same par so we could provide just superb care. So lastly, just some future recommendations and some changes that we've implemented that will be carried forward from the process of mentor-mentee relationships and staff development is the DPT-3 students will continue to have a meeting in April just before to help set expectations, make sure everybody is kind of on the same page with their mentorship process, and if anyone needs any help with that process. Updates to the packet just to make sure everything is up to date. And then continuing to do the mock screen, we got really good feedback from that just kind of helps students visualize what the whole screen looks like and ease a little bit of that concern there. So I will turn it over to the marketing team led by Danielle.
All right. Hello, everyone. I'm Danielle Simon. I'm the team lead of the marketing team. And here are our team members here. We have Kate, Chase, Allie, and Emily. We're very excited to talk to you all today about our endeavors with marketing for the community clinic this year. So, first, I'm just going to talk a little bit about our responsibilities as a marketing team. We collaborated with the Walsh University Marketing Department to draft some of the flyers, the postcards, and figure out a game plan for how we were going to distribute all of the above. We collaborated with the Walsh University print shop and discussed a budget, as well as how many copies we wanted to print and things like that to kind of finalize our flyer and our postcards to get sent out. And then we sent out the Save the Date postcards in December. We sent them out to about 45 returning clients, so people that came to the community clinic for 3+ years. We really wanted to make sure that those people had, the information needed so that they could sign up when registration opened, so they were given that opportunity to come back and support. We distributed flyers throughout the community at local businesses, churches, gyms, places like that, just to kind of get the word out. And a lot of places were really welcoming with our flyers and were welcoming with opportunities to help us advertise as well. We organized and collaborated for social media posts. So we use the Walsh University Physical Therapy Facebook, Instagram, as well as Walsh University's Instagram page and their Facebook as well to kind of market and get the word out some more through the internet. And we attended and marketed at a couple different community events. We'll talk about this a little later on, but we were able to go market at the North Canton YMCA and also at the Walsh University basketball game, as Chris mentioned earlier. Okay, so next here are the drafts of our final Save the Date card, which is on the left side, and then the flyer, which is on the right. We were actually really proud of these. I thought they turned out great. We actually got pictures from when we were first year, so you'll see a couple of our classmates up on those photos there. And again, we sent out 45 total postcards to returning clients, and we were able to send out and place over 60 flyers in the community for the community clinic. Okay. So just a continuation of our responsibilities. We sent emails to those that expressed interest at the YMCA and at the basketball games. So I know at the YMCA we went, I know Chase, Kate, and I went and presented there, and we had flyers so that they could fill out their information, like their phone number, their email, if they were interested after our presentation. And I collected about 25 people that were interested there, which was awesome. We were very thrilled with that. And I was able to email and heard back from actually a lot of them. And most of them did come to the community clinic, and I even was able to talk to a few of them at the community clinic that came from the YMCA, so it was great to kind of see that turnaround. We sent emails to local businesses, like I said earlier, and then we also took a lot of the pictures that you guys have been seeing on this slideshow throughout the community clinic as well. So I'm going to hand it over to Ms. Kate, and she's going to talk a little bit more about our goals and objectives.
Thank you. All right, so for our first goal, we wanted to gather information on the demographic of where our clients were coming from and from the main cities that they came from, so that way in future events we'll be able to market more directly to those locations. While we were very close, we unfortunately didn't meet our goal in how many clients we had registered. Our goal was 112, and we ended up getting 100, so that was very close. In the future, in order to bridge that gap, I think that future cohorts can attend more community events visit churches and follow up with the newspaper. While we did submit our flyer for church bulletins and the newspapers, we didn't see it come to fruition. So a little bit more of a follow-up in the future, I think, would help bridge that gap. Also, by distributing a few more flyers and postcards, that would be another way that we could get more registrations in the future. We were hoping that at least 35% of our clients came from returning years, and as you can see there, we far exceeded that. Our goal was 35%. We ended up getting 49.9% of our clients for this year from returning events. We also had 100% of our population come from our target age demographic, which was above the age of 18. And we had a 100% satisfaction from the clients that attended. We also gathered some information on the cities that people came from so that we can address those cities in our future marketing. We also addressed the client population and the appropriateness of their impairments, and we were able to meet that goal as well with our third-year survey.
All right, now we're going to move into some of the marketing outreach summary. So this is just a general overview about how our clients figured out about the community clinic. So 32 had previously attended the clinic, 9 found out about us from internet ads, 26 were referred from friends, 2 came from community events, and churches were 0. We did receive some feedback about this during the marketing process. Some of our clients said they did not see our ad in their church bulletin. We reached out to some of the Walsh University staff, and they did say that they had sent it out. It's just up to the churches when and how they use our ads. 9 came from the community flyer, 2 came from the newspaper, and 28 were from other. It's also worth noting that around 15 of our clients were family members or friends of the Walsh DPT students. Now I'm going to hand it off to Allie. She's going to talk about locations of clients.
All right, thank you, Chase. So a couple images for you. The first one we have here is the locations of the clients that came to the community clinic. As you can see on the graph here, most of our clients came from Canton, Ohio or North Canton, Ohio. Another representation of our graph here is our map of where everybody came from. So again, most of them came from North Canton and Canton. And if you see that arrow all the way over there, that is all the way in Fort Wayne, Indiana. So we had someone come over. It was about 3.5 hours drive. Good for them.
Okay, I'm going to talk a little bit about our interprofessional communication for the marketing team. So first, we had to speak with the Walsh University Marketing Department and Sean Ferguson in order to help to draft and design our flyers and postcards. Next, we had to discuss with the Walsh University print shop in the mailroom in order to get our budget together and distribute our materials and get everything printed. We also had to collaborate with the scheduling team for the community clinic about registration and marketing strategies to ensure that we got as close as possible to our goal number of clients. As we said before, we had to collaborate with the North Canton YMCA in order to have a presentation at one of their Silver Sneakers exercise classes. And along with that, we are also able to get some advertisements out to neighboring YMCAs as well. And lastly, we had to communicate with the Walsh University Athletic Department in order to be able to set up a day and time for us to go market at a Walsh University sporting event, which, as we said previously, was the Walsh versus Malone home men's basketball game.
Right. So here are some of our future recommendations for next year's community clinic. First off, target client population, we want to change it to be more community-based. Our goal for this year was just to have all our clients be over the 18 years of age. So we think if you change this to having a certain percentage of our population being from the North Canton vicinity, it would help increase our community outreach and make a more positive impact on our immediate area. Next, outreach to churches and newspapers. This is just a follow-up on some of the feedback that we got from our clients. So we feel that if we hand deliver those ads to the churches, it might help increase the carryover to getting that information into the bulletin itself. Include more community events. Like we mentioned earlier, we went to the Walsh University basketball game, and we also went to the North Canton YMCA. Those are great events, but it's never a bad idea to get out there a little bit more and get a little bit more outreach. Save the date postcards. So this year, like all of the save the date postcards went to clients that had been to 3 or more community clinics. We think it'd be a better idea to have them sent out to all the previous clients as well, no matter how many they went to. We could also reallocate funds from the 75 flyers that we got and put that more back into the save the date postcards. Then last one is the collaboration with OT students. We just want to get them more involved. Just more people means more outreach. All right, now we're going to hand it off to the scheduling team.
Okay, my name is Logan Green. I'm the team lead for the scheduling team, and then the other team members were John, Maddie, Kate, and Allie. I'm going to pass it over to John to talk about some of the responsibilities.
All right, so for the clinic, our responsibilities included getting a protocol together to register clients. So we use something called Eventbrite, and we worked with Sean Ferguson of marketing at Walsh to help put this together. Then we worked with the DPT1 GAs to help schedule the clients. And then we communicated with the clients, so we sent them a confirmation email and then a reminder before their appointment. And then we created the schedules for the DPT3, DPT1 pair, so this included the exams and observations. And then we analyzed the outcomes of the registration process. We did this through surveys, made sure everything went smoothly.
For scheduling goals, our first goal regarding wait time was met with 94% of clients reporting that their wait time was not longer than expected. Next, our second goal was met with 100% of clients agreeing that the appointment times offered were convenient for them. In terms of the registration process, all clients agreed that this process was well managed. Next, we were able to register 100 clients for the community clinic. However, this fell slightly short of our target client registration goal, and ways to improve this number was discussed previously with the marketing team.
Okay, so the next set of goals we had, the first two were measured with our post-clinic DPT1 and DPT3 student surveys. So the first one, we ended up having 98% of students agreeing that their schedule was well manageable. The second one, 100% of students reported that our live tracker that we use, which Logan will talk about soon, was at least somewhat helpful. Our appointment start time goal, basically we wanted to have all of our clients begin their session within 20 to 25 minutes of arrival, or their appointment time if they had arrived before their appointment time. So there was 5 people who didn't meet that goal, 2 of which were filling out the OT paperwork, which we ended up realizing was taking a lot of time. So we kind of excluded it in the beginning, but had them fill it out later on. So I think that's a good recommendation for future classes to follow up with and get clients seen sooner. And then the last goal we had was to fill at least 55% of our cancellations from the wait list, which we said we didn't have a wait list, we didn't have enough clients registered, but a lot of our cancellations actually occurred very last minute anyways, so I don't know that our spots would have been filled with people from the community. The spots that were filled, or the spots that were canceled like the day before, we did fill with community members, but the last minute cancellations, we ended up having some of our DPT3 students fill in as the client. And then these kind of show the first two goals that I talked about that were from our post-clinic survey. So 83% of students said that our live tracker was extremely helpful, with the remaining 17 saying that it was very helpful. And then only 2% of our students said that their schedule was not very well manageable, but the rest did agree that it was manageable.
Okay, so this is just a example of what our schedule looked like. So to start, we had a schedule between the scheduling team. We shared this in a Microsoft Excel sheet, and the scheduling team had access to it throughout the whole community clinic. And when people came into the lobby over there to check in, one member of the scheduling team was assigned at the table, and they were updating the schedule live, while the other member of the scheduling team was over in Betzler 230A and B, which is where DPT3 and DPT1 students stayed and waited for their patients and clients to get here and then check in. So it was broadcasted over a live TV screen and being updated live throughout the clinic. If you see here, the first one, 8 a.m. to 9:20 a.m., we had 6 rooms that we were able to use, with the overflow room being St. Martha's room right across the hall. The overflow room was used if people showed up late, or if people just came in and walked in and did not sign up, we could use that overflow room to accommodate them as well. You see here a little color system. So white, meaning the client's not here yet. Yellow, meaning the client has arrived or checked in for their appointment. Green, meaning they're ready to be seen. Dark blue is someone who canceled either early or last minute, and that was filled in by either a DPT3 student or a resident who was here also. And then the red was the client canceled. The client could have canceled early on or the day of. To meet one of our goals, we kept track on the schedule of the arrival times and updated that on the schedule so we could see that in Betzler 230A, and then also at the table here. And then the photo consent, we also updated the photo consent on the schedule. That was if the client wanted their photos taken or not during the session. And then I'll pass it over to Maddie.
As a part of the community clinic, the scheduling team primarily collaborated with occupational therapy staff and students, the Walsh University marketing director and marketing team, and the game day functions team. Prior to the event, we collaborated with the occupational therapy and PT students based on client availability to schedule patient slots. And during the event, we communicated regarding scheduling changes, which included patient cancellations and no-shows, room changes, and coordination of client information for documentation. Additionally, we collaborated with the Walsh University marketing director based on the creation of the Eventbrite for registering clients and also client communication prior to the event, so every client knew the details for the event and when their appointment time was. With the game day functions team, we worked together to determine the spaces and resources that were needed for the community clinic, and we also helped to coordinate volunteer roles, which included undergrad students and PT and OT student volunteers. During the registration process prior to the event, we communicated with the marketing team to recruit more clients and to ensure that the scheduling was open when the event started to be marketed to the community. And next, we have our game day functions team.
Hello, I'm Bonnie, and I'm the team lead for the Game Day Functions team. And this is my team, Miriam, Morgan, Gabby, and Cooper. There we go. All right, so these are our main responsibilities as game day. So generally, we were in charge of making sure people were where they needed to be and that they had tasks to do on the day of. So we were really busy on the day of making sure people knew where to be and what to do. And this was like a very adaptive group to be in. We had to kind of see how the flow of the day was going and adapt towards how the flow was. We were in charge of providing inventory for the community clinic, so making sure we had all the equipment that needed to be at each station for evaluations. And if we didn't have the necessary equipment for the clinic, then that was part of developing our budget, which is a couple bullet points down. We're also in charge of the flow of the day, so where we were going to have clients coming in, where we were going to have them sit for their evals, where we were going to have the observing and evaluating student PTs, DPT3s, and where the overflow room would be. We also had to create a layout so that when we were all coming into the Barrett Center to set up, we knew where we were going to put the tables, we knew where we were going to put the plinths and chairs, and we knew where we were going to have the overflow room, which was across the hall in St. Martha. We also had to develop a plan for telehealth communication if that would be necessary. This year we didn't have anybody sign up for telehealth. Everybody who participated in the community clinic was here in person. And then we also had to foresee any complications that might arise, any emergencies. So prior to the community clinic, we collaborated with campus police to do a intruder training just to make sure we were ready for any emergencies. And we also talked about a chain of communication for any medical emergencies that may happen with the clients. All right, and here are our game day goals. So first we have room cleanliness, and this goal was met. All clients that came were satisfied with the room cleanliness. Next we have satisfaction with parking and directions, and this goal was also met with almost 99% of clients being satisfied with directions on where to go and satisfied with parking lot directions. Next we have likelihood of retention. So about 99% of clients that came said they would like to come back again next year. And then overall, 100% of our clients felt satisfied with their overall screening experience, which is great. Next, this goal has to do with our third years and how they felt about the jobs and tasks that we had them doing the day of, and 100% of those of our students were satisfied with that. Next, we have satisfaction with hygiene during the exam, and so obviously we wanted this to be 100%. We had it at 90.8, but as we'll talk about a little later, it might be something to do with the wording of the question for that survey result. And then next is our telehealth services goal, which was not met because we didn't have any telehealth visits.
Overall, 84 clients, or 97.67% of all clients, rated themselves as very satisfied with regard to the cleanliness of rooms within the community clinic. Of those who did not rate themselves very satisfied, 1 client opted to skip the question, and 2 clients rated themselves as satisfied rather than very satisfied. Clients not only gave written feedback through the survey, but also provided verbal feedback regarding the cleanliness and the organization of the clinic. When asked about their likelihood to return to the community clinic in future years, nearly all clients stated that they would consider returning to the clinic again. 1 client did state that they would not consider returning to the clinic, and 1 client opted to skip the survey question. Overall, there was a positive response with retention of clients for future clinics. When asked about the ease of locating the community clinic, including parking, the event building, and registration, nearly all clients confirmed that they were easily able to locate the building. No participants opted to skip this question, and only 1 client reported that they had difficulty finding the different locations. This could have been impacted by the volunteer positions of students in the parking lot, building entrances, and various locations throughout the building in the event to help guide clinic clients to their destination. Many clients gave positive verbal feedback regarding the gratitude of students to escort them from the parking lot to the building for the clinic, especially with the poor weather that we had during the community clinic event. Other clients reported difficulty finding the parking lot from the street, and in future years, students may benefit from increased signage as well as volunteers positioned at the main entrances from the streets into the campus parking lots. In regard to hand hygiene and hand sanitizer use during the clinic, 85% of clients reported themselves as very satisfied with the hand hygiene of all students. Nearly 6% reported themselves as just satisfied, and 9.2% reported themselves as neither satisfied or dissatisfied. In future years, clarification during this survey question may increase the likelihood of having increased very satisfied clients. Listed here are some of the feedback that we got from clients during the community clinic through our survey. Overall, there was a very positive response from clients, staff, and faculty that came to the clinic and observed our performance. And many clients stated that they had a very positive engagement and would return in future years.
Okay, so I'm going to talk about kind of the flow of the days leading up to the community clinic. So on April 8th, this is where we sorted all the inventory. So our game day functions team, we actually met and we gathered everything such as pillowcases, linens, hand hygiene things, and anything we need for treatment. So this just made everything super organized for the 9th, whenever we actually had to come set up the rooms here in the conference. So again, also on the 8th, our team, we organized kind of like a little schedule where each group member of the DPT 3 class was in charge of specific items and also setting up specific areas of the room. This just increased the efficiency of the game day setup and just assuring that all items were in their proper places as well. So on April 9th, the day of the community clinic, ran very smoothly and efficiently, as all the DPT3 members were able to follow the key and set up the rooms accordingly. So kind of like Chris already mentioned, the community clinic wasn't here and it was divided into 7 sections. So we have it laid out here, and then we have the key as well. So we had different things in each room, such as plinth tables for the examination and the client to be on. We had an observation table, different stools, and then the red lines are our 10-meter walk test. The yellow is our tug, which these are outcome measures that the DPT ones did during the session. The room 7 was the occupational therapy room, which again was on the far left. This was St. Martha's room, and like Logan already spoke about, it was designated for overflow or anybody who came in early, late, or just walk-ins too. So again, each station had examination plinths, the proper hand hygiene stuff, and everything. All other equipment was in the back of the room if you needed extra things for the examination process, such as little bolsters or balls or anything like that. So we try to set up everything very efficiently and accordingly.
Okay, along with physically setting up the community clinic, we made a list of explained volunteer roles with the interdepartment collaboration with the scheduling team. And then we made an Excel sheet with all DPT3 students to access so that they could sign up for roles. So we had people at the door, people in the parking lot, the check-in table, the checkout table, just to make sure that clients knew where they were going. We required that all of our classmates sign up for at least 4 hours Wednesday through Friday. And then us as a team, we filled in all times that weren't taken just to make sure, again, that everything was going by smoothly. And then the only thing that we could have done differently with this is that for the Excel sheet, we could have blocked out times where clients were already here, just so that we didn't have students like waiting in the parking lot, waiting at the door. So for future reference for the next class, that's something that they can consider. And then as far as the community clinic cleanup, that was our job. We had all hands on deck, so our whole class helped with cleaning up everything. As you can see from the pictures,
Yeah, we just did a good job with all collaborating together, setting up the community clinic and then cleaning up the community clinic.
There we go. All right, so I'm going to talk a little bit about the day in the life of a Game Day Functions member. These are just some of the important things that we completed each day. First, we started each day just by ensuring that each space was clean and had everything we needed to perform proper physical therapy evaluations. We also communicated with volunteers just to make sure they knew where they needed to be and what needed to be done. Additionally, we filled in on the vacant volunteer spots just to ensure that we had a nice, proper, good flow for the community clinic each day. And then lastly, at the end of each day, we completed a miniature breakdown where we just found all of our assets, gathered them together, and locked them behind safe doors and got them to a safe place. There we go. Also, we had to use a little bit of our interprofessional communication skills to pull off what we did here. First, we had to discuss with other physical therapists to ensure that we had a proper setup. We had everything we needed for each room. We also had to talk with the occupational therapists to make sure that their space was conducive for their proper evaluation as well. We also had to meet with campus police. They helped us schedule a public safety awareness session, a run, hide, and fight training. And we also discussed room security and parking reservations for guests, clients that came in. And then lastly, we just needed to work with some other campus and community programs to reserve the Barrett Center here. And lastly, we worked with a local company that helped give us dividers and curtains to actually set up spaces for each therapy session. There we go. And now we're handing it off to the clinical services.
Hi everyone, my name is Mason Eckhart. I was the team lead for the clinical services team. My team consisted of Izzy, Luke, Stephen, and Michael. So our responsibilities, the first thing that we wanted to make sure was that we educated the third-year students on components of a health and wellness screen. Something that was really important for us to ensure was that we as third years weren't training the first-year students on how to complete a formal PT evaluation. It was much more broad than that. It was a general health and wellness screen for the first years. Now, if the third years, a client reported that they had some issues with their shoulders, a third-year student might jump in and assess the shoulder a little bit, more formally, but the first-year students, we don't expect them to be able to do that quite yet. Another big job that we had to take on was the forms. So we had to edit and go over all of the forms, including the intake form, consent form, client summary form, and first-year observation form. We had to educate the DPT-1 students on the 4 required outcome measures. So Maria gave us a great definition of what an outcome measure is. It's a standardized test used to objectively determine a patient's baseline function. All 4 of the outcome measures that we chose to use actually have cutoff scores that determine a client's risk for falls. Next, we wanted to develop and provide home exercise program handouts for the clients. That way they could actually go home with something, an intervention to do at home. We also provided any educational forms that were needed. If a patient came in and we took their blood pressure, they were hypertensive, we wanted to give them education on what hypertension is, how you can address it, and if you need to talk about it with your primary care physician. So one major change that we made this year was to the consent form. We wanted to make sure that it was reading at an appropriate reading level. So we used the Flesch-Kincaid score. This will come up in our goals. An 8th grade reading level is a proven way to capture every type of reader without bias, which is extremely important, especially when signing something like a consent form. So that was our main goal. We spent a lot of time on that, making sure that when a client came in, they knew what they were consenting to. Our intake form, we condensed for simplicity and ease of use. We took away some questions and added some questions. So one thing that we added was whether or not they had ever served in the military before. We wanted to know if they were interested in referral for personal training or gym membership, some of those, community things that Bill and Chris had touched on earlier. We added a question about vision. Medications was a big thing that we also wanted to address, so we wanted to know the names, dose, and times taken per day for medications. And then on top of that, we wanted to know if they were interested in learning about their current medication list. We added a mental health screen questionnaire, and we also added a health literacy question to ensure that clients actually understand their health. So something that we had as third-year students, we had a staff member come in and talk to us about health literacy and what it is. And we don't think about it very often, but there's a lot of times where people go to a primary care physician and they leave and don't actually know what happened in that visit. So we wanted to make sure that we had a question, and if they answered yes to this, we could provide them more information on what it is we were talking about.
So I'm going to give a little bit of an overview of our different goals as a clinical services team. As Mason mentioned, a large portion of our responsibility was the creation and preparation of forms for the clinic. So a lot of our goals have to do with the usability of those different forms. Our first goal, Mason talked about this a lot, but was the consent form being more readable, getting it pared down to that 8th grade reading level on the Flesch-Kincaid scale. And this was met as we were making our preparations for the community clinic. Our second and third goals had to do with our intake form. We wanted to focus on it being user-friendly for everybody who is going to have hands on it. So both the DPT students who would have to look over it prior to the appointment, as well as the clients who had to actually fill it out. And we met this goal with approximately 98% of both the students and the clients reporting that the intake form was easy to use. Our fourth goal had to do with the outcome measures. We wanted our students to report that the outcome measures that we provided were actually appropriate for the types of clients and demographics that they were having to serve. And this was met with 98% of students reporting that they were appropriate. Mason touched a little bit on home exercise programs. We had a massive table with about any kind of home exercise program that the students could possibly need. We wanted to make sure that we had everything that could possibly be appropriate, and we wanted that to be reflected in the survey from our students as well. We met this goal with 91% of our students saying that they had the appropriate home exercise programs that they needed to serve their clients well. Mason also touched on this, but a huge focus for our team this year was the idea of health literacy. So it's great if we have all of these forms, but if our clients don't actually understand the information we're giving to them, are we really being as effective as we can be? So we made 2 goals, both for the home exercise programs and all the educational handouts that we provided. We wanted the clients to report, yes, these were easy to read and understand. And we are happy to report that 100% of our clients reported that they were easy to use, which was really exciting for us. Our last goal had to do with the observation form. All of our first years observed multiple of their classmates performing the PT screen. And we wanted the form that they filled out to have some kind of perceived benefit. So did it actually aid in their reflection of what their classmates were doing? And 100% of the first years reported that the observation form was effective.
All right, so I'm going to talk a little bit more about what Izzy was talking about with our goals, but kind of go more into depth with the survey results that were received from clients after the community clinic. So the first survey result that we got was the intake form user-friendly? So as you can tell from the chart, pretty much a vast majority said yes, but there was one person that said no. Looking into the feedback, even from some people that said yes, they said some things that we could change would be making sure that we add a little bit more space, specifically with the name, where that is, but then also in certain past medical history areas such as surgical history and things like that. So overall with that form, we could add a little bit more space for next year. The next one was, did you feel that the home exercise program provided was appropriate and easy to read? And thankfully, 100% said yes. So We didn't really get too much more feedback on that, so yeah, that was great. And then the next one was, did you feel that the educational resources provided were also easy to read and appropriate? And again, 100% said yes, so we were really pleased to see that. And then that is it for the survey results. I'll pass it on to Stephen.
All right, hi everybody, my name's Steven. I'm going to share with you another success of the clinical services team that didn't make it onto our goals list Izzy went over. And really it's because when we started, we were not sure how realistic this goal would be. So like Mason said, our responsibilities really were all the paper forms for the community clinic, which as you can imagine is a lot. And we wanted to try and reduce the amount of paper waste as much as possible. And to explain why, there were 1,500 copies of educational handouts and home exercise programs made last year, and only 301 of those were used. So like it says here at the top, that's nearly 80% of the documents being contributed to waste. And as a team this year, we really wanted to try to reduce this. One, for the obvious environmental reasons, but two, printing in this quantity adds significant cost to our clinic. And we contemplated different ways maybe we'd go about accomplishing this. First, we thought maybe we could go all digital, but kind of knowing our target demographic, we thought maybe that wouldn't be the best solution. We also considered potentially printing on site as needed, but logistically, we figured this wouldn't work because students would probably be bottlenecked out in the hallway trying to print their documents, and this would also add significant time to their evaluation. Until finally we kind of asked ourselves, what happened to the 80% of the documents left over last year? So we were able to actually find those, and we dug them out and we started counting. I think it took us a couple days to count through all of them. But eventually we had them all at kind of a baseline number, and they were all nicely sorted into different folders. And by reusing what we found, this saved us from having to print any additional education handouts or exercise programs for this year's clinic, which was kind of amazing. And here at the bottom, you can see we provided a total of 240 handouts this year, and at the same time contributing to zero paper waste. Now, some of the other documents that we were responsible for were the outcome measures that you've heard a lot about. Last year they had about 9 extras, and they had various copies of each. In total it was about 110 copies of these outcome measures, and only 5 were used. So knowing that the 4 that were required would be appropriate, we questioned if these extras were really adding anything to our evaluation. So we ended up not including them this year, and instead we added just 1, and that's the one that's here on the slide, 4 functional tasks for wheelchairs, on the chance that someone maybe would present to our clinic in a wheelchair. Since we didn't anticipate many, if any would, we went ahead and printed just 1 copy and had it laminated so it could potentially be reused, which again significantly reduced our paper waste. Now, we couldn't reuse everything. As you heard, we did make some changes to our documents, and those had to be printed. In total, we made 356 new copies, and only 88 of those, or roughly 25%, were not used. But overall, 88, that's not too bad. So this is just a visual summary, because I kind of threw a bunch of numbers out at you guys. But this just compares the paper waste produced from last year's clinic to this year's community clinic, which was decreased 94% with less than 90 copies going unused this year, which as a team we were very happy with. Next, I'm going to turn it over to Michael.
All right. So our team met with the OTs and collaborated with them in email format as well as in-person meetings to establish their personal needs. And one of those was the Promise 29, which is a forum that has 7 health domains that the OT students would give the clients, which consist of physical function, fatigue, pain, depression, anxiety, participation, social skills, as well as sleep. After they had, established the Promise 29, they handed it back to us, and then we were to ensure that the clients completed it. Furthermore, collaboration post-clinic to ensure OT subjective reporting tools were stated factually in that manner. Then we also met with our own colleagues between teams for efficient, effective flow for the events leading up to, during, and then after the community clinic as well. Next, I'll hand it off to the documentation team with team lead Andrew.
Hello, everyone. My name is Andrew Simons, and I was the team lead for the documentation team. So I would just want to start with going over what our primary responsibilities were. Our first thing was in educating both the DPT-1 and DPT-3 students on how to use the documentation system. This was important for the first years, as this was their first time experiencing how to use a documentation system, and this would be an important part in their clinical rotations upcoming. The next thing is we provided materials to both the DPT-3 and DPT-1 students on how to make the process a little bit easier, and I'll have my team members talk about that in a little bit more specifically, but we just wanted to make sure that the process went smoother and they had specific instructions on what to do. Also, a big part of what we did for our team is providing troubleshooting the day of, as there were issues that came up, and we'll get into that later as well, but we just wanted to be there as a team to answer those questions for either the DPT-1 or DPT-3 students. We also managed the collaboration of the OT and PT students in the APTA Connect system because there were problems with OTs and PTs being in the same chart at the same time. So we were responsible for managing who was going to document when and how the setup for that went. And then lastly, my group, after the completion of the community clinic, performed chart reviews on one of each of the DPT-1 students' evaluations just to make sure that everything was done correctly. And then I'm going to pass it over to my team now.
Hello, my name is Jamie. I'm part of the documentation team. So as a team, we kind of looked at what documentation had done the previous years, and we made some updates for the community clinic this year. So some of the updates that we had made, we provided a documentation instruction sheet for the DPT-1 students. We also provided a step-by-step checklist for completing the documentation. We also provided some instructional videos to kind of help with the APTA Connect, which is the documentation system that we used. And finally, we created some examples of HIPAA do's and don'ts for the DPT-1 students. And here are just some examples of what we had provided for the DPT-1 students. So the first picture is just an example of the student checklist. So it just goes kind of step by step on what should be provided, or I'm sorry, included in the documentation. And then here's another example of the instructional sheet. It had some pictures that kind of showed what the documentation system looked like. And we also had some goals for the documentation team. So our first goal was that 75% of the DPT-3 students would report that their mentees only required about 4 to 6 corrections for each examination. This was measured via the post-clinical survey that the DPT-3 students had provided, and we were able to successfully meet that goal. The next goal was that 90% of the DPT-1 students would use the appropriate medical terminology in their documentation. This was measured, like Andrew had mentioned earlier, via the chart audits, and we were able to meet that 100%. The next goal was that 75% of the mentees would report the documentation reference sheet to be at least moderately friendly. This actually ended up not being assessed as it was not included in the post survey. Our fourth goal was that 75% of the DPT-1 students would report that the tutorial that we had provided for them prior to the community clinic starting would be at least somewhat helpful. and via the post-clinical survey that the DPT-1 students filled out, 100% of them said that it was at least somewhat helpful, so we met that goal there. And finally, our last goal was that 100% of both DPT-1 and DPT-3 students would ensure that all forms with client information would be in the appropriate folder at the end of each day. This was measured via the recording of any adverse events, and we were able to meet this goal with 100%.
So just going into the specifics a little more off of what Jamie's talked about. So given the feedback from the forms, the surveys that we got from both DPT 1 and 3 students, we were able to get some feedback on how we performed with the materials and the assistance we were able to provide to all of the students. So the first one, in addition to those materials that Jamie showed pictures of a minute ago, Andrew also went and made a video recording going through the documentation system that the DPT-1 students were able to access prior to the community clinic. The idea was if they at least were able to see someone clicking through it and the specifics and what we wanted them filling out, it would make it a little more readable, a little more friendly as they were going through it. So going into the specifics on this, all of the respondents denoted that this was at least somewhat helpful, while the majority of them reported it was very helpful. So again, while everyone did seem to have a perceived benefit with these, we would like to see obviously more people in that very or extremely helpful range, but with that being provided for the first time as part of our cohort, that is definitely a positive outcome. In terms of DPT-3 student feedback, so again, going into the tutorial for learning the documentation system, all of our students denoted that they felt this was somewhere between very and extremely helpful. Upon discussion with the documentation team, we kind of figured this could also be the result of us having more experience with documentation systems. We also kind of would go and tell our mentees, like, this is a really hard system to learn for your first time. So it's possible that as we were going through this for the first time, we felt it was a little more beneficial because we kind of knew what we were looking at, as opposed to some of the DPT-1 students. They might not have had quite as good of a grasp of what they were looking at. But again, across the board, there was a perceived benefit with the tutorial. Going on then to the reference sheet. So the reference sheet is what Jamie provided a photo of at the beginning, where basically there were instructions on what you were supposed to be clicking when, what you were supposed to be entering in different boxes, and there was a screenshot of the screen provided along with it. So it wasn't just like, hey, find this and click on it. It was, this is what this looks like, try to find this little bit, and then enter this information as follows. So again, in terms of how user-friendly was this, everyone rated that it was at least somewhat user-friendly, while the majority, 75% of our students reported that it was very user-friendly. So while there is room for improvement in future cohorts, again, there was a perceived benefit within the DPT-3 class with this resource. Then, in terms of game day functions, DPT-3 students reported that the majority of them did require assistance from the documentation team sometime throughout the day. So again, while the goal would be that we streamline this process as much as possible, where they don't need as much assistance from us, things do happen, and there were some technical difficulties that came throughout the day. So we were able to respond to that. In particular, Andrew did a really great job. He was the guru with the documentation system. And we were able to get at least the majority, if not all, questions answered for all of our students in a timely manner. Then lastly, just going into the specifics of the documentation system, more or less while you're filling it out, you enter all these different bits of information over a bunch of different slides, and at the end it generates a Word document. So at the end of the day, when like the PT residents from the VA or our supervisors within the PT program were going and looking at our documentation before they would sign off on it, they would be looking at that master document. So in theory, in a perfect world, all of that information would carry over that you entered in all those different tabs into this master document. Unfortunately, we don't live in a perfect world, and that didn't always happen. So the majority of our DPT3 students reported that all 3 times that they had an evaluation, there were some instances of something not being carried over correctly into the Word document, which is something, as we tested it out before the community clinic, we didn't have the same issue, but then myself included with my mentee, there were times you had to go back and manually enter things. So that's another recommendation we have for our, for future cohorts, is look into that a little more, see what can be done to prevent that, but we were also able to communicate with all the teams to make sure they knew what had to be manually entered in the document as well.
All right, so some adverse events. You can only control what you can control, and things don't always go as planned sometimes, so sometimes you just gotta try your best. One of the challenges my group ran into is that the documentation system itself, APTA Connect, sometimes it would change the way initial evaluation was generated onto the document. And then also another challenge was that the PT and OT students couldn't document on the same chart at the same time. And not every piece of data from the documentation system was being pulled onto the evaluation. So some of the outcome measures and sometimes the assessments were not always pulled through onto the final document. And then if the OT students not follow the instructions of the documentation process, some of the PT students' work would not save all the time. So those are just a few of the challenges that we ran into. And then the results of our audit, like Andrew was saying, our group members, we kind of scrubbed through all the completed documentation and went through with a checklist to see if everything was being met. And we found that one of our goals was that DPT1 students will complete the initial eval with a minimal of 4 to 6 errors. And we met that with 93% accuracy. And then another of our goals was that DPT1 students will use the appropriate medical terminology of no more than 2 errors, and we met that with 100% accuracy. Some of the most common errors that we ran into were that most people refer to clients as patients. Patients just rolls off the tongue pretty easily and flows out the fingers when you're typing, but the correct term for the community clinic, all the people who came were clients, not patients. And then another error was that again, as I mentioned, the outcome measures were not pulling through onto the final document all the time.
So then just to wrap up everything from my group, overall, the process of documentation has improved since last year and since our first year. That was my main goal during all this, was to improve it from when we had it, just because we had less materials than this. And I think it'll continue to get better, especially because we took all of the changes we did and gave those for next year's class to have, so that they don't make the same mistakes that we did. In addition to this, the DPT1 students all rated that they liked the materials and that they were helpful to them. And like I said, we'll continue to have those for future classes. Adverse events do still persist with this APTA Connect system. That's not the fault of the students. That is primarily just the fault of the technology that we're using, because there was no specific reason for why things wouldn't pull over or would pull over for specific students. Some suggestions that we left for next year's class is to have a specific day for OTs to document, so that there is no overlap between things not saving in the documentation system. And in addition to this, having in-person walkthroughs with the DPT1 students and the OT students, so that everything is clear as to what the instructions are. And then I'll pass it over to referral management.
All right, we all good out there still? We're almost done. 2 more groups. Okay, so my name is Taylor. I'm the team lead for the referral management, and then my wonderful team that assisted me consists of Katie Kearns, Troy Grabowski, Tyler Giesige, and Abby Miller. So kind of moving on to just purpose and responsibilities of my team. We were in charge of compiling a list of previously used referral sites, as well as finding new referral sites and putting them all together, getting their acceptance, and kind of putting that together based on site. By the end, we had about 300. So kind of a lot in the grand scheme of things. A lot of people we talked to. We then created user-friendly forms for the DPT 1 and 3 students to utilize and provide for the clients. Educated those DPT 3 students on utilization of our referral sheets through email, and tracked and documented those referrals we made at the community clinic. So I'll hand it over to Katie to talk about our goals and outcomes.
All right, so I will just give an overview of the goals that we set for ourselves and how we performed on those. So the first goal was we wanted to allow ease of the use of finding these references for future classes. We were able to meet that goal. We logged all of our references organized in a way they can find them in the future. We also wanted to increase the number of referral sites. We wanted to add 5 more new sites to the referral directory. We were able to meet this goal as well. And then we also had a number of goals related to a referral management spreadsheet. So we ended up opting not to use the referral management spreadsheet, so all of these goals were not met due to that. We decided not to use the spreadsheet due to the amount of traffic in the hallway and limited resources. So it would have been difficult and an added step to stop and track the names of clients who received a referral. So we ended up deciding that there's no need for this year or really for future years. Next goal that we had was to work efficiently together and create an all-inclusive list of referrals for the community clinic without conflict. We had no issues with that. And the next 2 goals were also related to the referral spreadsheet tool. So we wanted to use the tool to track all of the referrals provided, as well as the population. So it was supposed to be, it would allow us to track if we had referrals for clients ages 65 and up or under 65. But unfortunately, as I previously stated, we were unable to utilize this tool. And we decided to track the referrals based off of the number of papers that we gave out. So we would just count the number of sheets that we had at the beginning and then count them again at the end of the day to see how many sheets we gave out per day. So this worked very well. One thing we did not consider, however, was how to manage the clients who may have received multiple referrals in a day. So that may have skewed our results a little bit. Another goal that we had was that 80% of students will answer yes to the overall ease of the use of the survey tool, so that was also not met because it was for the survey tool. We wanted to contact 100% of our past referrals to make sure they were still able to take clients by the end of our fall semester last semester, which we were able to do. And then we wanted at least 33% of our community clinic clients to receive a referral, which we were also able to meet.
So I'm kind of going to go over the data that we collected over the 3 days of the community clinic for like how many referrals we gave out in total. So at the beginning of the community clinic, we had a total of 196 referrals spread out between all the disciplines that we decided to kind of include in the day. And then day 1, we gave out a total of 19 flyers. Day 2, we gave out 31. And then at the end of day 2, we were running low in terms of outpatient PT referrals and then a pelvic health referral. So those were printed additionally at the end of that day. And then we gave out 3 referrals the last day. So as you can see, day 2, we gave out the most referrals. And day 3 was kind of a shorter day. So that also led into why we gave out less referrals that day. And then in total, over the 3 days, we gave out 53. And then looking back, the top 3 were outpatient ortho, neurological, physical therapy, and then personal training. And then also some that surprised us were TMJ, senior programs, and then nutrition and food insecurities that kind of followed up after these top 3 referrals. I'm going to hand it off to Troy.
All right, so the next couple slides were the survey results that the clients filled out after their appointments that were specific to referral questions. So the first one was, how likely are you to attend this referral appointment? As we can see from the results, 58% said they were very likely, 27% said they were somewhat likely, and then 13% said they were not likely. And so we can see a decent, margin said they were either not likely or somewhat likely, 40% of them. So this could point to some potential improvements in the following years. One possible solution would just to provide adequate education as to why the referral that they're getting is important for them to attend. It could also be beneficial to maybe, find out through the survey the reason why they were not likely to attend the referral. So was it transportation, financial reasons, just to kind of get an idea of, how we can, get them to that referral. And then the next question we had was, do you feel the referral provided to you was appropriate and fit your needs? And as we can see from these results, 67% said yes, 31% did not receive one, and then only one person said no. So we're happy to say that the majority did feel like the majority of clients felt like the referrals met their needs. I'll pass it off to Tyler.
All right, so I'm just going to talk a little bit about our strengths and weaknesses of our referral team as a whole here. So one strength was the sheer number of referral options that we had available to all the clients. There was a ton. We had a table full of just different referrals that we had available to the different patients. We also added new referrals this year, including free services, more personal training services, and then local yoga studios. And we used all of these new referral services this year. We gave out some. Another strength was the referral options that were separated by discipline this year. This was the first year that we decided to use this, and it made it very easy for the first and third years to just go after the evaluation was done to get a referral option for their clients. We also had excellent communication throughout the entire week of the community clinic with the team members, with Bill and Chris as the team leads. We had a different number of referral options that were handed out who participated. As Katie said, we met this goal. We handed out just over about 67% of our clients who needed referrals. So, and then lastly, our adaptability, as Katie mentioned, switching from that use of the referral tool that we thought we were going to use, and then switching about a week or two later to just counting the number of referrals at the end of each day. Here's just a picture of what a referral sheet looked like. As you can see, the community resources, we had all the different locations that you could go for any of those. And then lastly, with any strengths comes weaknesses. So we had a couple here. Our first one being the tracking of referrals. So as other people previously mentioned, when there were cancellations, we would have either PT or OT students fill in. And if those students were given a referral, this kind of could have skewed our data a little bit. So we didn't take that into consideration at first. We also kind of lacked a little bit of communication with the Walsh Exercise Science Department, as many of the students who, many of the first years thought the free training program that we could give out to some of the patients was in the spring or the summer, but it was really in the fall. So more communication there could have been done. We had a lack of a pulmonary rehab referral, which could have benefited one patient in particular during the community clinic. And for this reason, we didn't have one because we had an inability to connect with a specific pulmonologist based on the large hospital systems in the area. And then lastly, we had a little bit of a lack of direct follow-up with sites regarding brochures or flyers that they would want to present to patients with. But we didn't receive any of these, even though some places said they were going to give us some. We never received any, and if we did, they were provided electronically, and we were unable to print due to the cost of the printing.
So lastly, I'm just going to talk about our recommendations for the future community clinics. So first is just simply updating referral forms for the referrals that are indicated, such as including pulmonary rehab, like Tyler had mentioned. And then also recommending closer tracking of the number of referrals given to each client. So if one client got one referral, if one got two, or if multiple. And then, so this could be remedied by an additional job position for game day functions and someone sitting at the referral table to kind of keep track of how many referrals are given to each. And then, again, the pulmonary referral, so this would be recommended for future sites. And then we also would like better communication with the Walsh Exercise Program. And this might include more flyers and information to give to clients at the beginning of the community clinic. And then following up with communication with the occupational therapist program as well, just getting more OT referrals from their side, just kind of branch out and receive more of those. And then we'll hand it off to John, and he'll go over strategic outcomes.
All right, so I was in charge of the strategic outcomes team. We didn't have a formal team, we had liaisons, so I want to give a big shout out to them. They took a little bit more responsibility by being a liaison. So Chase, John, Maria, Troy, Morgan, and Rachel. Hopefully I didn't forget anybody. And Luke. I think I got Luke on there. So basically our job was to quantitatively and qualitatively collect data on the clinic. So you saw all the graphics and information that came from a lot of the surveys that we were able to put together as a team. Number one is the client survey. That's the biggest one. People coming through, we want to see what their feedback is. So everyone completed that. That was 100%, so that was a success. Second was the time to complete it. In the past, it had taken a really long time. If things take a long time, people don't want to do them. So the goal was to trim it down a little bit, which we were able to. However, basically when you pull up the survey, it starts the clock, so we weren't aware of that. So there's several outliers that kind of expanded the time that it took to complete, but overall people spent a few minutes. So technically it is not met. In the future, we'll just have those teams wait to pull up the survey to get accurate information there. Another one was the repetitiveness of the survey, which we've had tons of feedback in the prior years that the same questions are being asked and things are being spoken about a ton of times. So we tried to pare that down. Unfortunately, didn't do as good of a job as I probably could have, but we got 81%, which is close. I think the biggest thing is serving the community need. Chris and Bill talked about in the beginning. Everybody that is coming is the most important to the survey, to the clinic. So we want to make sure that we're serving the community, and that is the main outcome of what we're looking for is client satisfaction. So we had 100% people say the appointment times were convenient, 99% say intake form was user-friendly, and then everybody, 99% said that parking was useful. So those are the big community aspects. People coming in, what they're saying was positive, as well as the overall experience of the clinic, and that we all were professional DPT 1s and 3s. And then we had 99% people said they would come back, so that's always great. Next is that we want to give the DPT 1s a chance to experience clients for the first time, and that's a major aspect of the clinic. So feedback from our residents saying that DPT 1s have the ability to enhance their clinical reasoning and get their first experience was very positive. That's a big takeaway of the clinic. And then it also gives us as DPT 3s a chance to kind of be a CI or clinical instructor and see what that would look like as we walk into entry-level practice. So we all got the experience to take on one or maybe two students and lead them through a process and just be there to kind of see how the other side sees it. We all kind of saw it from their seats 2 years ago, and now we're kind of on the other side of it, so we can pass on the knowledge that hopefully we have now to help their transition into their first clinicals. Things to improve in terms of the big takeaways from the clients. Documentation talked about it. Faculty is aware of the documentation system, and we're looking to improve that. And I think the one thing that anybody might want is lunch and coffee. So that's we'll put it out into the atmosphere, and we'll see what happens for next year. But overall, it went very well. And now I'll have Chris come up and just conclude everything for us here.
right, we made it. So, like John said, I'm just going to wrap it up here. So overall, the community clinic was deemed a success. It was a positive experience for all the attendees, or almost all the attendees that came, and it was a really good opportunity for us to educate and foster health improvements for all the clients that did end up coming. And then the domains of wellness that I talked about earlier on the slide as well. There we go. So as we kind of talked about and Bill touched on to start, we really want to try and push PT into that primary care prevention. So this annual screen helps to really help stop that disease from like setting in. So we can kind of see warning signs or things ahead of time and really just work to help a patient possibly avoid falling into like being diabetic or things like that. So also we can help with limiting their limitations for functional mobility. So with this, we see that with any kind of functional mobility limitation, you can see an increase in fall risks, decrease in patient compliance, and overall increase in healthcare costs. So this health screen will really help us just to kind of further PT as a profession and also help people save money in healthcare costs in the future and just make the healthcare system a more efficient machine, as I'm sure we've all dealt with some inefficiencies. So we are the PT. PT is the movement system experts, so that's really the functional mobility limitations are really where we can thrive and grow, and this helps, as I said, get us into that primary and secondary care roles. So that's all we had. Does anyone have any questions or anything before we wrap up?
First, I'd like to say congratulations. All of you have done a fabulous job, and I think we can all see the work that you put into this over the past, I don't know how many months, since last November. So you guys did a great job with that. The one thing that I have a question about, and it's just more for information for us, you didn't speak a lot about the role of the resident. So we had, in this part of this community clinic, we had residents who are licensed physical therapists from the Veterans Administration up in Cleveland. Can you just speak a little bit? It doesn't have to be the two of you, but anybody. Was that a positive experience? And is there any information you'd like to share about that?
Yeah, so the residents were, as we said, we had licensed PTs watching over, and those were very often the residents or a faculty member watching over. So with us being third years, we've gone through 4 clinicals, but we obviously don't have the expanse of knowledge that a faculty member working in the clinic for years would have, or even those residents who are getting very intentional hands-on mentorship at the VA have. So they were able to kind of speak into any like nuances we may see and really help us if we were stuck on how to guide a first year to kind of work through their eval, they would help and just kind of direct them and give us food for thought too. So it wasn't always saying like, hey, you have to do this. It was more like, hey, if you see this in the clinic, because they knew that us as third years are getting close to graduation, they were like, hey, consider this. Like, it's something that might help you a lot in the future. Yeah, definitely.
Thank you. Did you have any information about how many people visited physical therapists prior to coming to your clinic? I know you mentioned some people came every year, but did you collect any data regarding that?
That's your team, so I'll let you talk.
I'll cover this one since it was part of the intake. So in our intake form, we always had a question asking if a client had received physical therapy services in the past. And a lot of times we would have our DPT1's mentee kind of ask the client, so what did you receive PT for? And kind of have them outline that a little bit for us. However, we didn't necessarily track what number of clients had this in the past. And that could be something that would be beneficial down the line to kind of see like if there's any trends in like the individuals who come back, whether they've have had PT in the past or if they are new to the profession, and this is a way to welcome them in.
Hi, great job, guys, everybody here today. I'm just wondering, you guys had a large number of individuals who were returning clients from prior clinics, and I'm curious if you guys were able to access their data from prior screens and use that in your decision-making for referral sources.
Alrighty, so similarly, a lot of the stuff that they from previous years was in the documentation system. So we could go in with our DPT1s and kind of see like what had been done in the past. Something though that with this is that we would see that more after the fact. We would get their paperwork on the spot and we would review that very quickly. So we couldn't necessarily see if they had a referral in the past, and that would be something that again could be beneficial to kind of track and see if we can follow up and see if they did actually go with that referral or if we're making multiple referrals to the same people every year. If that answers that question.
Overall, great job, everyone. So I have one follow-up question regarding documentation. Obviously, not the easiest system as you reflected. Can you give me a reflection on previous systems maybe you've used from documentation and how they were maybe a little bit easier compared to the ones that you were using for the community clinic?
And just to make sure that I'm like understanding the question correctly, so like documentation systems that I've used like out in practice or?
Yeah, it doesn't have to be any specific one by name, but the ease of use from the other ones you've experienced from your professional experiences.
Sure. I feel like with this documentation system for APTA Connect, there's just multiple spots to put the same bits of information. And with the instructional sheet that we had, it helped kind of guide us a little bit to where exactly to put that information. But sometimes our DPT ones would find another area and it would mark the same thing. So like reflexes, let's say, you can mark it in neurological, but then you could also mark it in another location. And then they would come to us and be like, well, should we mark it both times? And a lot of times we would say only mark it in what the instructional sheet said. So that made it more efficient. But then sometimes when we ran into issues with it maybe not pulling over all the way into the final Word document, then we were like, okay, well, we had to find another way around that. So I think just the fact that there's multiple places to put things makes things a little bit more complicated on the end of an individual who's putting information in and trying to handle that.
Thank you.
Any opposers?
I remember your marketing group said they went to a basketball game, I think it was, to try and entice younger people to come. So 2 questions. Are you seeing mostly older people at the clinic? And have you thought about changing your marketing flyers for younger people? Because I'm thinking, oh, I'm 18, why do I need to go to a PT clinic? Would it be better to change the marketing some way to entice them to come?
Yeah, I think the majority of patients or clients that we saw, I messed it up there again. The majority of clients that we saw definitely were probably above the age of 60. And part of that is I think with available times too. As I said, like with the schedule, a lot of the appointment times are during the day. So it's just easier for the retired population to get there through the majority of the appointment times that are available. As far as filling in with like younger demographics, I feel like we could have a flyer or a marketing form to specifically do like the basketball game or to try and get the Walsh students maybe in the future, and that might help get a little more of the younger demographic into the clinic.
You guys did a really nice job. I'm really impressed with the effort that went into collecting data and presenting that to improve the outcome of the clinic. My question is about mentorship. So when John was up, he mentioned that you all had just gone through 4 clinical experiences. You were the students, but you had an opportunity now to flip into the mentorship role. So during the staff development, was there any like formal organized effort to get all of the third-year students on the same page about how you were going to mentor the first-year students, such as like strategies for feedback or encouraging them to self-assess in any sort of standardized way, or was it kind of just you did what you did?
There was some direct examples that we could use based off of kind of what we've experienced through our clinical experiences as far as like letting them self-assess. A lot of it was left to the mentor and mentee pairing, I feel like, because everyone's different and everyone learns differently. So, and we have the experience from our clinicals of what we thought was most beneficial to us in helping us grow as clinicians. So that's, at least I tried to make sure Bill and I shared a mentee. So we tried to communicate with him and just really make sure we were communicating to him in a way where he would be able to grow from it. So we had 3 evals, and after the first one, we gave him some feedback. We let him try to work through most of it on his own, and we really only jumped in if there were like some things that we really had to ask. So some of the red flag, like screening questions that he might have missed, or he might have been a little flustered because it was his first eval, trying to get his feet wet. But yeah, so I think it was really kind of person to person and mentor to mentee relationship, and just trying to collaborate with our mentee. So, and I think Caitlin has something to add.
Going off of that, in terms of, we had a mentorship assignment in the fall where we were supposed to reflect on our personal experiences within clinical practice as a mentor and how we would be moving forward. So even though that was a formal part of our class work, it wasn't necessarily a staff development organized effort. It still did have us reflect on how we would be as a mentor and what we'd like to continue forward with.
One more question.
Thank you, all of your class, for coming together in this amazing presentation, just sharing what you did. And this question can be for both of you, or if there's anyone in the class who'd want to raise their hand and share their experience, I'm sure Dr. Monti would come over and give you the mic. But I'm just wondering what the biggest impact moment was for you during this community clinic experience. Was it a specific patient that you saw? Was it that opportunity to be a mentor? Was it that teamwork and communication that you needed to pull off such a big event like this so smoothly? Or was it something totally different? So just wondering what our students' big impact moments from the clinic were. And again, it can be for you two, or maybe someone else wants to answer.
Okay, so my big impact moment was with, so I had 2 clients. One client that was mostly primary prevention, but then I had 2 clients that were more of a tertiary prevention situation. And with a passion for neurologic patients, I was thrilled to have a client who came in with Parkinson's disease. So for me, the big impact moment was being able to educate the client and his wife, but also being able to help my mentee in that situation. Kind of like instilling some of my interests and passion into my mentee.
I'll stand up. I think my big impact moment was having my mentee look at me and tell me that she felt so much more confident after her first evaluation. So we've all been there. It's totally nerve-wracking. Once you look back, it's just a general health and wellness screen, and you actually learn so much more in your clinicals. But for her to At the beginning, she told me how anxious she was. She was so nervous. She wanted me to be fully hands-on with her, right over her shoulder. And then even after the first one, her looking at me saying, I feel so much better. You've given me the confidence to kind of be more on my own. I think that was my cue to step back a little bit. But that was a big impact moment for my mentee to, be confident in her skills and ability.
Thank you. Thank you all. Thank you, Chris and Bill. Any final remarks?
No, we just wanted to, we just wanted to thank the faculty that helped us plan all of this. As we all knew, we stepped into this and we didn't realize how much truly, as first-year students, you don't realize how much truly goes into it. So just having direction from Dr. McCallum, Dr. Walter, and Dr. Monty, just pointing us in the right direction and kind of helping us organize our thoughts and our game plans. And just want to thank everyone for coming out today and celebrating us as a class.
All right, class of 2024, you are done with all of your academic stuff, so congratulations. All right, so we're going to take a 30-minute break. There are some light snacks, I should say, out over this way. You need to use the restroom, stretch your legs, and we will begin back around 3 p.m. Okay, welcome back, everybody. I bet you all of the graduates can breathe a sigh of relief. You have a little bit of sugar in you right now. But just to reintroduce myself, my name is Dr. Christine McCallum, and I have the pleasure of serving as the program director for the Doctorate of Physical Therapy program. For our graduate celebration right now, I will serve as your MC. And if you use the scan, there's a brochure, and we will follow those orders of events. So I'm going to begin and invite Dr. Tony Doty to the stage for our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And I would like to announce or invite up Luke Jacobs for our blessing.
All right. Hey, everybody. I'm Luke. I get the honor of starting us off with a prayer. So if anyone could bow their heads with me. Dear Lord, we just want to thank you for today. God, thank you for just the opportunity that we have to spend together here in fellowship and just to celebrate the achievements that everyone has worked so hard in. Lord, I just want to thank you first and foremost for your provisions and you just allowing us to get to where we are today and providing us with safety and support. Thank you, Lord, for the teachers and the faculty and all the students, Lord. I know we've had some great friendships, and the teachers have spent a lot of time teaching us and molding us to be great PTs in the future, Lord. So I just want to thank you for that. I just pray, God, most importantly, I thank you for sending your son to die on the cross. That is the most important thing, God, and it is through faith in him that we can be saved. And I just want to, just thank you for that, Lord. I pray that as we go forward today and into the future that you would just keep us safe and keep us secure, Father, that we would honor you with how we treat our patients, that we would put their needs above our own, and that we would remember that we did this for a reason. We did this to help other people, and especially when the mundane parts of the job start getting in the way, that we would remember our true calling, Lord. So I just pray for safety, pray that we would continue to have that joy that you've given each and every one of us. What a blessing it is to be able to be here and have that degree, Father. Thank you so much. Pray that we would just be able to fellowship together and enjoy the rest of the celebration, and that we would give you all the honor, God. In Jesus' name I pray, amen. Thanks.
Thank you both. So before we honor our graduates, I'd like to introduce to you our faculty, our staff, and our university administration who have supported us and guided us, all of us, in the past 2.5 years. First, I would like to introduce the university president, Dr. Tim Collins, and his wife, Drenda, and I would like to invite Dr. Collins up to say a few words.
Okay, swords up! Swords up! Swords up! Swords up! Too quiet in here. This is a celebration. Luke just said that. Luke, did you say this is a celebration? Celebration. Celebration. This is awesome. Well, Christy, I do note that this is at 3 o'clock, which in the Catholic faith tradition, this is the hour of divine mercy. And so we find ourselves here in the Easter season. In the Catholic faith, the Easter season is 50 days long. So 7 weeks plus a day. And 7 weeks is about 1/7 of the year. That number 7 pops up everywhere in our tradition. But on the Sunday after Easter, in the Catholic Church, we now have a feast that's called Divine Mercy Sunday. And this was established in the year 2000 by Pope John Paul II. And this was the result of a lot of study on the writings and the experiences of a Polish nun in the early part of the 20th century named Sister Faustina. And Sister Faustina had 14 apparitions with Jesus himself. And Jesus asked her to help find a way that we could celebrate and know of God's mercy. So when John Paul canonized now Saint Faustina, he established this day, this Divine Mercy Sunday, as a way to remind all of us of this mercy that our Lord has for us. Luke basically just gave an amazing prayer that speaks directly to this. You know, St. Thomas Aquinas, he is the patron saint of students. He's the patron saint of our university, of all universities. His statue stands right over there. And he tells us that mercy consists of taking a thing out of non-being into being. And so here we find ourselves celebrating the last 3 years. And the good Lord has been awfully busy the last 3 years in the background in the lives of all these students. He's been doing things we can't see, we can't measure, we can't control. And in fact, in some ways, we don't even understand. But we do know that he has transformed these students into being the people that they are today, and as Luke said it so well, whose mission is now to go serve others with a skill set that very few others have. Not just the mechanics of it, but I don't even know how you all in this career field actually get past, patients like me that just lie to my PT. I don't know, you guys having clinics, any of your patients ever tell you something maybe wasn't exactly the way it was? And you guys have to figure that out. But how do we explain this? I mean, simply, how do we explain this transformation that has just happened? For me, I can sort of understand it with one word. And that word is risk. See, I think for all of us, risk is deeply woven into all of our lives. We're taking risks all the time. We risk getting in the car. We risk getting out of the car. We take a risk when we're outside when it's raining. We take risks everywhere. So for me, I think the worst thing that would happen is if any of these graduates ever now decided they're done taking risks. Because I think if you do that, you're going to end up where you don't get anything, you don't feel anything, you don't achieve anything. In fact, you become nothing. Because the fact of the matter is, these students took a risk when they came here into this program. Am I really prepared? Can I really get this done? Can I survive this coursework? Can I really do this clinical where they're counting on me to know what the answer is? But these are calculated risks, because these are amazing people. And the faculty saw in all of these candidates, when they issued them this invitation to join us, they saw in every one of them this opportunity to be called into being something that they weren't then. So the faculty who spent 3 years molding, crafting, shaping, and beyond, and as you guys know, they're likely to call you back. They're going to reach out to you. I want to say thank you for that. But it does come down to risk. And you cannot grow if you're not willing to take a risk, and our students are proof positive that that would be true. So as you turn the page, I guess you can go this way, as you turn the page and you start this next chapter of this exciting journey of life, we should be thankful that this Lord, with his great mercy, gives us a gift of living hope. And so your faculty's proud of you, your university's proud of you, Trenda and me, we're proud of you. And our hope is for your continued success on this journey you've chosen, with your patience, with your vocation, and that you would just take away one nugget of your whole time here. And this is the idea that dreams don't work unless you do. Every one of you chased a dream. Isn't it amazing? You just caught the bus. Swords up. Swords up. Swords up. By the way, just one more thing. At about 1:30, Brenda and I are going to slide out because we have another event. So I don't mean to insult Ryan, our speaker. I mean no disrespect to our graduates. I'll for sure see you on Saturday. But when I walk out, there's nothing nefarious about that. So thank you for having me.
I can't beat that energy, so thank you very much for the swords. So I'd also like to recognize other university administration who was not able to join us today. Dr. Mike Dunphy is our provost and vice president of academic affairs. He was here earlier for the beginning of your community clinic presentation. So we thank him for his support. And also the dean of our school, Dr. Pam Ritzline. She is the dean of our School of Behavioral and Health Sciences, and she is not able to be with us today, but she sends her deepest her congratulations and please offer her and her prayers as she's going through some difficult times within her family. So you are in her thoughts and prayers. So now I'm going to introduce our faculty, and I'm going to ask them to stand as I do so. Oh, no, I'm sorry, before that, I want to introduce your class representatives and your class leadership. So as I introduce your class leadership, I'm going to ask you to stand. So the president of your class was Troy Grabowski, so thank you very much. Thanks. The treasurer of your class was Morgan Oldak. Thank you very much. Money person. Your fundraising chairperson was Miriam Fetterman. Thank you. Your class liaison, who I've seen quite a bit over the last couple weeks, was Izzy Miller. So thank you very much. And then your East Central District liaison is the person who we rely on to be your advocate with our professional association, and that was Bill Magda. So thank you. These 5 individuals helped organize things between the faculty and your class and some internal, external things. And I do appreciate Troy and Miriam's tenacity and bringing back the 5K for the program. So they put a lot of hard work, and all of you helped out with that. So thank you very much for all that work over the years. And I don't know if this is like high school or not. If you're the class president, you're the one that has to organize everything moving on. So we'll see how all that goes. All right, so now I'm going to introduce our DPT program faculty and staff. As I call your name, I'm going to ask you to stand. They don't like to stand, and they don't like to bring attention to themselves, but without them, I have their support, they have my support, and they are always looking out for all of our students. So I thank them very much from the bottom of my heart for everything. So I'm going to start with Ms. Pat Crum. Please stand. She serves as our program office manager. And I do have to say, she has been truly God's blessing to us. And I hope I don't cry. So we hope that you enjoy this last one with the class of 2024, because this will be her last one, because she is retiring at the end of June. So she wanted to wait until today to announce that with all of you, but thank you so very much. So next we have Ms. Joanne Kramer. Please stand. So Ms. Kramer serves as the coordinator of our clinical education program for both the graduate programs in physical therapy and occupational therapy. And she really is the behind-the-scenes taskmaster who ensures that the program, as well as all of you, got what you needed to do beforehand to make sure your clinical education experiences started off successfully. So thank you very much. Next is Dr. Lexi Larison. Dr. Larison serves as our Director of Clinical Education, and she is a specialist in geriatric physical therapy. Dr. Larison has expertly guided you throughout all of your clinical education experiences, and I think she's done an amazing job to get you where you all need to be. So thank you very much.
Next is Tony Doty. Dr. Doty is our pediatric clinical specialist who threads her love for kids throughout our curriculum. She somehow guides all of us to bring a little bit of fun to our teaching, and then to hope all of you've realized that if you're working with kids, it has to be play. And I think as we get older, that's hard for us to sometimes to play, so we appreciate that. Next, we have Dr. Katie Fitzgerald. Dr. Fitzgerald is a specialist in neurological physical therapist, but I like to call her my Swiss Army knife. Because she can do a little bit of everything, and she helps out programmatically with Ms. Crum and with me and with all of you. And then when she joined our faculty, she is now oversees our evidence-based practice series, and she's done a great job of pulling all that together for all of you. So thank you. Dr. Jamie Paz is next, and he is our faculty member who oversees our foundational and advanced clinical decision-making courses. He's a key member of our cardiovascular and pulmonary courses, and he is a bedrock for sound advice. And one piece of advice he gave me a few years ago was just to remember time. And I think that he would probably like to leave that with all of you. And you know, we have to take time for ourselves, but there's a time for excellence in our programs, and there's also time for excellence and to have a little bit of fun outside of our work. So thank you very much. Dr. Monty, Ryan Monty is next, and Dr. Monty is our core faculty member in our MSK sequence, and he is our sports clinical specialist. He has masterfully guided all of you alongside of learning about sports, his upper extremity athlete specialty, and him alongside Dr. Walter were the key core faculty to help guide you through your community clinic project, and led you through that excellent presentation that you guys did today. And you'll hear a little bit more from him in a little bit. So thanks, Ryan. Dr. Lauren Roscoff is next. She is our core faculty member for our neurological course series, and she is a clinical specialist in neurology, neurological physical therapy. She has been very instrumental in joining us and with all of you of revising and updating and innovating in our neurological course sequence, and we really appreciate all her work. Thank you. Dr. Alicia Walter is next. She is our cardiovascular and pulmonary clinical specialist who is our key faculty member as well in that course series. She serves as our admissions coordinator, and she is a big reason why all of you are here today. So thank you for your service. Dr. Jenna York is an orthopedic clinical specialist, and she teaches in many courses throughout our first year of our curriculum. She has provided exceptional leadership as we integrated our 3 cohorts into an integrated leadership board, and she has worked with your leadership team and the others in our DPT2 and DPT3 classes. So thank you very much for your leadership. A faculty member who I do not see here that I don't think you had the pleasure of having in as your anatomy and neuroscience curriculum, but Professor Lorinda Smith is also on our faculty, and she welcomed, I think you guys were in your second year, but hopefully you've had some interaction with her, and we do appreciate everything that she brings to our program. So thank you very much. I don't think I missed anybody, did I? Did I? Ryan's pointing. I don't think I missed anybody. I wrote it all down. So thank you very much, all of you. Our next event is your keynote speaker. So every year the class is invited to select or let the faculty select someone to do a keynote address. And this year we are going to welcome Dr. Ryan Monty to the stage.
Get this on my level. All right. Okay. Maybe. All right. So, esteemed faculty, President of Walsh University, graduates, family, and friends of the class of 2024, thank you for the honor and privilege to be here today for the celebration of our Doctor of Physical Therapy graduates. It is amazing to see all of you here today, and it is truly an honor to be asked to be your keynote speaker. To reflect on the sacrifices and accomplishments you and your families have made to get to this point, and the hope and excitement a promising future beholds is something to cherish. A little reflection from me. You are the first Doctor of Physical Therapy class that I've taught from the very start to the end since I started teaching here at Walsh. I remember being involved in some capacity in a lot of your foundational coursework, and there was a time I had each of you in class, as I would say, every Monday and Wednesday for a large portion of your graduate lives. From upper extremity material and biomechanics, baseball examples, abstract theory and motor learning, and the development of hands-on skills in the musculoskeletal curriculum. With this said, you would think they had heard enough from me at this point, but here I am. Not to deliver another lecture, not to provide another assignment, but to give you some insightful words of what the future holds. With all levity aside, it is an honor to speak to you one last time. From previous reports, physical therapy is the top 5 in healthcare occupations by size. In Ohio, there are thousands of licensed residents who serve our local communities every day. You are now amongst a practicing profession that will continue to impact those in need. We can bring much hope to those we encounter. Was it worth it is a question to ponder. I can truly say that our profession is in a great position to aid with many growing needs in healthcare, which provides opportunities in many areas. The profession of physical therapy is situated to improve climbing healthcare costs and not only improve someone's life after they have suffered an injury or ailment, but also be a part of a larger equation to prevent or reduce injury in a positive manner. Benjamin Franklin once said, "An ounce of prevention is worth a pound of cure." We continue to provide excellence in care, but also strive to be innovative outside of traditional models, such as our community clinic. Never lose these thoughts, because this landscape will continue to grow, and we as a profession will be the positive catalyst. As you enter into this glorious field of practice, you will encounter many opportunities. Many of you today may pose the question to yourselves, what is next for me? From finding a job to developing a niche practice. We have a versatile profession that can provide us the ability to wear many hats. My advice is continue to learn, continue to grow, and most importantly, develop your professional identity that provides meaning for every day you step foot out of your home to leave an impact on those you provide care to. But also find the balance that fits you. There are so many options that lie before you. You do not have to do them all. You do not have to pursue perfection. Your personality, your empathy, your purpose is what makes you who you are. Never sacrifice personality for perfection. Some may say there is an opposite to anything and everything, which many call the law of polarity. But to reflect, we can describe this as balance. As a working professional, some days will take more energy than others, where pieces of your life fall with ease for one day, and while other encounters are not so generous. It is easy to analyze the negative, but harder to embrace the days that are easy. The sunshine after the storm can provide a perpetual hope of positivity. Embracing the next sunshine is something we must always do. And in Northeast Ohio, I can truly say those days can be few and far between. But we look past the gray to find the light, for it is often easy to think about the next upcoming storm. Creating a positive space can provide the balance of life from one patient you may have struggled with to reach their goals to the one that was less complicated. Pursuing a better outlook and looking past the storm can improve mental balance. As a professional, you will have opportunities to impact many and wear different hats. Life is very dynamic, and circumstances will change. Your impact will continue to grow, and you will be involved in various arenas. But keep an objective view on balance and the time spent in these various areas, and avoid imbalance. and look at life from a holistic point of view. Keep your families and friends close. You can't control everything, but you can continue to look through the rain for the sun to shine again. Most importantly, remember why you pursued this professional endeavor. Not to achieve greatness for yourself, but rather to place the patient ahead of you. Utilize the tools that you have refined these past years with your passion and your work. Your success will be for those that you serve, and you will remember the meaning of your sacrifice. This will be the identity that carries you through those tough moments, those long hours of documentation, and that one last phone call that needs to be made before you return home to see your families and friends. For all of you, this is an amazing moment. This is a time to celebrate. But it also reminds me of a poem by Peter Dale Wimbrough titled The Man in the Glass. I'm not going to recite the entire poem. However, the overall premise is that you only be at ease with yourself if you can look in the mirror and accept what you see. The poem goes on to state that you can be a king for a day and receive many pats on your back along the way, but you will cheat yourself if that person staring back at you is not your friend. Self-reflection serves a high role of importance and responsibility. For us to look in the mirror and be honest, hold yourself accountable, and make the sound ethical choices that you know how to make. Yes, you will make a mistake, but calling yourself out on this mistake takes that ability of importance, that ability to see that self-reflection, to always do what is right. Remember those that you will touch with your healing hands, the advice you provide, and connections you make, and you will love this profession for years to come. Inspiration always comes from somewhere or maybe someone. All of you here can probably recall a difficult conversation in your life where you needed a little extra push. The people that have been there, maybe they're the ones sitting next to you right now, are the ones that continue to be that glimmer of inspiration that drives you. For me, it was the idea of belief, the belief that I could create my own path. However, creating a path is sometimes a road not taken, a path not traveled, a road with many turns and a lack of cellular service without GPS. Your journey is your own. Embrace change and never conform and feel you need to follow. Instead, lead your own way into the future. It can include creating your own practice, doing research, developing a continuing education course, whatever it may be, create your own path down the road less traveled. But to travel, the road takes one step at a time, not a giant leap, but a gradual development to transform. Early in my career, I encountered opposition that sent me down a path that I did not want to mentally travel, and it took recollection of past inspiration to pull me through. Each of you will embark on challenges on this road, maybe even self-doubt. But I truly tell you, each and every one of you, that you are good enough. You are better than good. You are excellent, and you are amongst the ones that are valued. The footprint that you leave on society is bigger than you will ever imagine. At this point, I consider all of you colleagues. So please, there is no more Dr. Monty. There's just Ryan as we address each other in the future. Finally, I'd like to say congratulations. All of you did it. Graduates, I express my gratitude to you with the time that we have spent together. And I would also like to express gratitude for the individuals that have supported you through all these years. It is their influence that has provided a great contribution to your academic success. My final remarks include remembering who you are, reflect on who you serve, recall inspiration, and rejoice in finding balance. Thank you, and I wish you all the best in the future.
So thank you, Ryan. You said my favorite word a couple times in his talk with us, reflection. So because it's a big part of what we do as physical therapists. We're always reflecting on what we do. Are we doing enough for our patients and whatnot? So thank you very much for your words of advice. Okay, each year, the class, the students of the graduating class select someone to give final words of advice, wisdom, whatever they so choose. So this year, I would like to ask Taylor Records to come up and to share with us a few words as a representative of the class of 2024. Taylor.
All right. So you get to see my face again. I know I only spoke to you briefly earlier, but for those that do not know me, my name is Taylor Records, and I'm graduating on Saturday, and I'm so excited. So my class kind of already knows I like to talk, so why not grace them with me talking some more on our last gathering together? I think by now they know that I'm very verbose. I say what I say, and sometimes I don't think before I say it, but that's just my personality. So whatever comes out of my mouth during this, take it with grace. So when I found out I was the only one who signed up to do this, thanks guys, I knew I couldn't drown out about boring topics, and I had to figure out a way to kind of make this a little fun, bring a little laughter, and not bore you to death. So originally, I was gonna make you guys all get up and dance to Eye of the Tiger from Just Dance, but I'm not gonna do that because it's too hot in here. So instead, I'm just gonna tell you a story, give you a little laugh, because this still makes me laugh to this day. I don't know if many of you know this, but at least you can think about this the rest of my speech if it is boring to you. Hopefully not, though. So my second clinical was an inpatient rehab facility, so very hands-on with the patient, more intense for those of you that don't know, kind of working, getting these patients back to full functioning. So teaching them to walk again, teaching them how to at home kind of adapt to their environment based on whatever they're in rehab for. So I had this patient, and she was amazing. She was this very sweet old lady, always made me laugh. I spilled her catheter bag many times on myself and her, and it was just a running joke that we had. You know, it happens, urine happens. That's just PT life. At least I like to think about that when you're in a rehabilitation setting. She was the most wonderful and gentle human I've ever met. She was in because she had a hip replacement and needed some help at home. So we would always just chat about kind of how her home setup was, and her dog would come to visit her in the evenings, and unfortunately I never got to meet her sweet puppy, but it was like the light at the end of the tunnel for her to be able to go home and go back to her puppy. So unfortunately, she just wasn't making great progress. I'd been working with her for about 2 weeks. Just the swelling in her legs was just too much. So I decided with my CI at that time that she needed TED hose, which are a type of compression sock, kind of goes knee high, and that was something that was just gonna help kind of get that swelling out. So in the facility I was at, we had a whiteboard, and we would write down kind of precautions for the patient, so certain like leg movements she wasn't allowed to do, that we wanted her to wear the TED hose many times, and just various things like that. So the nursing staff knew how to mobilize her, get her in and out of bed, and kind of go from there. So that day I had gotten her to the bathroom, gotten her back to bed, and left for the day, wrote on her whiteboard, TED hose at all times. Hopefully you see where I'm going with this. If not, let me explain. My CI texts me an hour later and goes, Taylor, do you know how to spell TED hose? Because you spelled it wrong, and occupational therapy noticed, and the patient noticed, and now she's just laughing and laughing and laughing about it because it's not spelled H-O-S-E, it's spelled the other way in my mind. So I think it just, in the end, like, I just couldn't help but laugh at myself, and I think my CI just thought I was not thinking, which I wasn't, and, you know, we all have those dumb moments, but I think for kind of my patient's sake, because at that time she was just feeling very down, that was something that she needed to make her laugh. So every time I would see her, she'd be like, I got my Ted hose on today. And we kind of just would go off of that the rest of the time I had her in the clinic. So I think that was something that I learned from. I looked up some words in the dictionary I might not have known how to spell, and I won't make that same mistake twice. So hopefully you can not make that mistake, and if something embarrassing happens, just go with it. Like, I think the biggest thing I learned in kind of clinicals is stuff's gonna happen. You're gonna spill a catheter bag. You're gonna pull out a fecal management tube by accident. You're going to not remember to get consent from your patient, even though in reality you have the consent because they're there to see you. And who knows, you're probably gonna treat the wrong ankle because you don't remember that it's actually left and not right. But you know, it happens. So my class knows that I like to kind of embarrass myself and say things how I say things. So I want you guys to think about our first day, orientation day in fall of 2021. A hot August day, humid, sweltering, and we are wearing professional dress in a one-window classroom. So picture that in your mind. I think kind of thinking about that first day, and it's hard to speak for everyone, but the thoughts that I was most worried about was, am I wearing the right professional dress? Because I don't own any polos, but hopefully this shirt works. What even is professional dress? Because at that point I was like, I'm shooting for the stars. And I think I emailed Ms. Crummett about 5 times asking if I could wear certain items of clothing because I wasn't sure. The next question I thought was, do I know where I'm going? I'm sure many of you who hadn't been on campus before probably had that same thought. In reality, I went here for undergrad, so luckily I knew where I was going, but it was still kind of, how do I get up to the department? Am I going into the right room? And luckily we had the staff there to welcome us. Am I going to make friends? I think, and where am I going to sit were the biggest things that was going through my mind. I came in not knowing many people, and I came out knowing everyone, so I got something going for me. But I think at the end of our first day together, the biggest thing we all were thinking was, wow, I am sweating, and I can't wait to peel these clothes off as soon as I get home, because it was 90 degrees in the classroom. And if I have to do one more team building thing, I'm leaving, because that day was full of team building activities, full of frustration because we kept making mistakes and we were trying to work together, but who the heck is this person standing next to me? I don't know her, or I don't know him, and kind of just getting used to that was different. But I think the thing that we didn't know is that was just the first of team building activities. And luckily, I think we're at the closing part of that. So kind of thinking about the first year of school, it was definitely tough. We had a lot of stresses to hold on to, and although we had those stresses, we made a lot of memories. We got through anatomy with Dr. Kaplia. We got through neuro with Dr. Kaplia. I think that says enough in it, if you remember. I can't believe I'm even remembering that first day we were doing all those team building activities, but the one thing I could remember was Allie Zukowski was the girl I sat next to, and that's who I was gonna go find on the first day, because all I knew was her name and her face. So by the end of our first year, I knew everyone had some sort of interaction with each other because we were randomly being paired together for checkoffs. So even though I didn't know John Bazzelli, he was my partner for this checkoff, and now I know him. So we spent a lot of time together kind of getting to know each other through that. And I think although we wanted to pick our own partners, I think it definitely was for the better because you got to know each other. And we began to develop friendships and our cliques, as we like to say. So kind of thinking about our second year, we as student physical therapists began to grow and blossom. So I remember in August of that year, we were all coming off our basic neurointerventions course with Dr. Roskoff, motor learning, and whatever evidence-based practices, which at the time, who the heck knew? The summer was definitely a blur. I think because we were all trapped in the Timken basement, sweating our booties off because, once again, one window in that classroom kind of definitely kept us warm. But luckily, Dr. Monti gave us lots of breaks where we could kind of walk away and get some air. I remember reading kind of all of our LinkedIn conversations on our first clinical and hearing about all the new exciting techniques that my classmates were learning. But in reality, it was the same thing that we learned in our basic MSK course. So kind of thinking of this minute special test for the ankle. Ooh, cool. In reality, it's like something that's so basic, but it was so overwhelming to us at first. It's kind of weird to think about that it was just so much. And now it's like, snap of the finger, I can do this anterior drawer test. Let me just do it real quick. Let me eval my family real quick whose foot is hurting, or let me take a look at your back. Like, I think it's funny to kind of reflect on. But I think on our first clinical as well, being able to complete an eval while holding that conversation, while trying to impress your CI, while documenting, and thinking about everything going on when you're heading back to school was a lot for us to think about. But in the grand scheme of things, we're going to be doing it every day for the rest of our lives. So, just think about that. Lots of self-reflection. So coming back from clinicals, I think we're all around the high of, I want to stay out in the field. I don't want to go learn anything else. I'm done. Or some of us were like, outpatient ortho is not for me. I didn't like my second clinical. Let's see what else the world has to offer. After many skills checks, large exams, group projects, and presentations, we made it through that 8 weeks. And then we were looking forward to that month-long Christmas break to not do anything. And let me tell you, that was the best break of my life. I lived it up. In the most professional way possible, of course. So, everyone's still good. I'm hoping I'm not boring you, and things are making sense. Good? Okay. So, another thing about me is I am a very observant person. So although I'm loud in your face, as I am right now, my ears are always turned on. So our second year, I made a lot of observations. I saw many people in my class grow as adults, clinicians, and in our cliques. We have our special groups, we branch out into our groups, but you always end up back to your clique, as I like to call it. But it worked in the best way for our class dynamic. And I think that's what kept our class we stuck together in the end. We gained 3 classmates our second year, bringing us to a grand total of 37. And I think that was just what we needed. We are the biggest class. We are the biggest class, so let's go. During our second year also, I saw greater, stronger friendships being made. I myself found some of my best friends, you know who you are, in which I don't think I would have made it through school without them. They definitely were there for me in my highest highs and my lowest lows. And there were a lot of lows, a lot of remediations, a lot of just things you had to work through. And that's the cycle of grad school, as they like to call it. So, during our second year as well, I also saw many classmates grow in their personal relationships. I watched marriages, engagements, and even new dating scenarios that are still continuing on after all the stress of PT school and licensure. So congratulations, Chase. She's waiting for a ring, so start saving up. I told you my ears were always open. It was a year for us, I think, professionally for growth, physically, mentally, and emotionally. Of course, there were many tears, especially after the OSCEs. Sorry, Dr. Monty. But we still made it through and we're still graduating, so an OSCE, what the heck? In the grand scheme, it was scary. But now, let's do it. Our third year, which is now, was a very quick one, I'd say. And I think many of my classmates are thankful for that. But boy, did we have a heck of a lot going on. We began with clinicals for 10 weeks, came back in full swing, guns a-blazing, preparing for community clinic, which you just heard about, for 2 hours. We were creating an algorithm, which felt like the never-ending project, and completed our evidence-based projects and presented them at the ECD. Is that what that was? Yeah, the ECD when it was here in September. Oh, and not to mention, we had to start making a study plan and preparing for our licensure exam, which was the most tense and stress I've ever seen this class. So I was watching. I don't think I've ever seen Bill so stressed in my entire life. I have to tell you, I would meet him and Abby in the classroom early, before class. And the way he just started rattling off everything he had to do, and Abby and I just sat there and laughed because we were going through the same thing, but internalizing it, and he was just letting it out. And I think it was the funniest thing I've ever seen because I never thought I would see Bill stressed externally. But it's okay, Bill. It's over now. Until your first day, of course. The last year definitely was very stressful, but there's a light at the end of the tunnel. Many of you guys accepted jobs, residencies, and further education opportunities, which I didn't believe would happen so soon, but it did. So congratulations for that. We have big girl and big boy jobs now. So don't be afraid to let it out because it's a big accomplishment. And it gives me so much joy and excitement to see and hear about everyone's future. I think our class has a great future ahead of them, and I can't wait to hear about it on Facebook and LinkedIn. So if you didn't get a request from me yet to be friends, just wait, it's coming. Because I want to be friends and I want to know what's going on. Until we, of course, meet back for like our 10-year reunion or whatever. And we all have kids and we're all burnt out and you're like, why did I do this for 7 years and blah, blah, blah. But it'll be okay. So here we are, Thursday, 2 days before graduation, which will be named Dr. blah, blah, blah of physical therapy. And we'll wear those cool hats that are octagon and make us look like weirdos. But it's legit. And we'll be the only ones in there wearing it. So I expect everyone to be looking their best so I can get pictures with all of you and lots of smiles because this day to come is a major accomplishment that we did. I want to wish my class luck with their future. I know I will see great things from you guys as I have already seen so much. I know this is sappy, but I'm proud of you all that you never gave up and pushed through, even though there were days where you wanted to throw in the towel. I want to thank you all for putting up with my consistent side comments in class, accepting me for having at least 2 to 3 drinks and snacks every day, and being open to listening to me today, because of course, like I said, no one else wanted to. But it's okay, I'm not salty. I like to talk, so. I want to take a moment and wrap up and thank the faculty for being there for our class and helping us when we needed it. I remember many times I would walk into Dr. Monty or Dr. Walter's office, or even Dr. McCallum's, and just talk with them. Dr. McCallum and I went on a couple walks outside, and that was what I needed to clear my head before going back to studying at times. You guys taught us pretty much everything besides clinical CI things, and I think that we owe you guys a huge thanks because we wouldn't be here without you guys, so thank you. I'd like to thank my family also for being there continually and pushing me to do my best, even when I wanted to give up, because there were times. My mom and I have this saying, I got this. I have this little bear, and he has a little sign on him that says, "You got this." And I truly believe that if you just say that word, "I got this," and strike your power pose, anything is possible. So I want you to take that as I leave here with you today. The next big scary life transition is happening. First day on the job, orientation day, meeting all these new people, trying to make new friends, and of course that nice paycheck. Sit in your car before you walk in, tell yourself, "I got this," and then go in. And if you need anything, I'm here with snacks, always. Thank you.
Okay, thank you, Taylor. We now are beginning our awards part of our graduate celebration. And I have the honor of presenting the first award. But before that, what I'd like to say is, if your name is called, that we ask you to come forward. You may receive a package, a medal or a pin, and if you receive one of those, we ask that you wear those at graduation on Saturday. So the first award is our National Honor Society. The National Physical Therapy Honor Society is sponsored by the American Council of Academic Physical Therapy, or ACAP. This society honors students who demonstrate excellence, integrity, and professionalism, and the student must be in the top 5% of their class academically, and they need to be members of the American Physical Therapy Association. Today, we induct 7 students in Delta Phi Tau, DPT, which is cute. So each of these students have demonstrated high academic achievement and were involved in numerous leadership experiences throughout their time with us, and even in either service or research endeavors, or oftentimes both. As I read your name, we ask that you please come forward and remain standing in front until all students have been introduced. Honor Society certificates and pins will be mailed to you from ACAP at a later date. So our first one is Allison Brazier. Allison was a co-leader for our evidence-based practice project group, which investigated best practice outcome measures to use at Metro Health Medical Center. She also worked alongside a clinical instructor to develop a health and wellness program for new mothers following cesarean birth. Allison worked with Refuge of Hope, which is a local organization serving the unhoused population in Canton, an organization which she is passionate about. So congratulations, Allison. Our next student is Madeline Cantor. So Madeline's passion for service lies with an organization called Pray, Hope, Love, which raises money for pediatric brain cancer research, where she volunteered for their annual 5K. Madeline also assumed leadership positions in 2 research projects during her time with us. Both involve benchmark research creating reference data or reliability measures in the young adult population. She followed her passion for the pediatric population in both her service and scholarly endeavors. Congratulations, Madeline. Caitlin Crawford. Caitlin participated in leadership roles in our community clinic, the Program 5K, and most notably organized and initiated a Special Olympics Young Athletes organization on the campus of Walsh University. This campus organization is comprised of both undergraduate and graduate students. These coaches volunteer for children aged 2 to 7 to foster inclusive play. And we thank Caitlin for bringing this type of organization to Walsh. We haven't had that, and it's going to be lasting for years to come. So she was also involved in a research project with the Metro Health Medical Center. So congratulations, Caitlin. Next is Maria Johnson. So Maria volunteered at several events throughout her time in our program. She educated students of all ages, kindergarten on up, about physical therapy and participated in screening events to help prepare kids for school. She also conducted original research in Dr. Tony Doty's research group examining the reliability of the easy angle range of motion, and she presented this project alongside her fellow classmates at our district event. So congratulations, Maria. The next is Bill Magda. Throughout Bill's time in our program, he has served in leadership positions in various capacities. These have included the East Central District Rep for his class and a project manager for our annual community clinic. He has served clients of all ages during his clinical experiences in Fort Wayne, Indiana, and he also included extensive research on outcome measures that would improve the efficiency of clinical care during his third clinical experience. Congratulations, Bill. Izzy Miller is our... So among Izzy's service activities included serving her fellow classmates as class representative to the faculty for the class of 2024. In this position, she also served on our student leadership board, which is integrated with the DPT-1 and DPT students of the program. She's also volunteered at Pegasus Farms and volunteered for various events within the program, such as STEM Day for high school students. For her research capstone project, she worked alongside her classmates, integrating best available evidence for the Quality Improvement Project at Metro Health Medical Center. Congratulations, Izzy. And next and finally is Emily Mercandante. So Emily's service also included the start of the Special Olympics Athletes Organization on the campus of Walsh University, where she has served as vice president. She also served the program by participating in open houses for future students and set up assistive technology fair. She completed a systematic review for her evidence-based practice project. So congratulations, Emily. So please join me in congratulating the Walsh University's class of 2024 into Delta Phi Tau. Your names will now be part of the ongoing list found on ACAP's webpage. So congratulations to these 7 graduates.
My name is Dr. Alexia Larson, and I am so honored to be presenting the Clinical Excellence Award. The Joan C. Nethery Clinical Excellence Award was established in 2000 with the graduation of Walsh University's first PT class. The intent of this award is to honor a student who actively accepts the diverse role of a physical therapist professional, including the ability to work with a variety of patient populations and professional staff, and who is an advocate not only for the patient, but for the profession. This individual exhibits the potential to demonstrate clinical excellence after graduation and become a clinical mentor to fellow colleagues and students post-graduation. The criteria for selection are as follows. The awardee must be a member of good standing of the American Physical Therapy Association, must have good academic standing, must have positive ratings in all 4 professional experiences, must have experienced physical therapy practice in a minimum of 2 different practice settings that encompass the lifespan of patients, must demonstrate professional behaviors consistent with the core values of the physical therapy profession, must have demonstrated exceptional service to one or more of the following: the PT program, the university, the professional association, or the community. The Director of Clinical Education will nominate potential awardees, and the award is selected by the faculty. The 2024 Clinical Excellence Award goes to an individual that positively shines when it comes to embracing clinical education and the opportunity to serve others. She completed professional clinical experiences in a variety of diverse settings, including outpatient orthopedics, a clinical with the U.S. Department of Veterans Affairs in the Veterans Health Administration, hospital-based pediatrics, and inpatient rehabilitation. Clinical instructors and faculty have taken notice of her bubbly personality, positive and collaborative attitude, and desire to serve others with compassionate care. This student was instrumental in ensuring clinical excellence during the 2024 Walsh University Doctor of Physical Therapy Community Clinic by serving as a team leader. She was the impetus for the development of a campus-wide initiative to start the Special Olympics Youth Activity Club to serve children and families in the local community. The class of 2024's Clinical Excellence Award goes to Caitlin Crawford.
By the way, unless you're wondering why I'm up here, I'm the Vice President of Academic Affairs, President of the league, so I'm what's up.
Hello, everyone. I'm Dr. Alicia Walter, and I am honored to present the Professional Service Award for the class of 2024. The Professional Service Award was established in 2005. This award was initiated to acknowledge a student who demonstrated exceptional contributions to the physical therapy profession during their tenure as a student in Walsh University's physical therapy program. This award is selected by the faculty. Hebrews 13:16 states, "And do not forget to do good and share with others, for with such sacrifices God is pleased." The recipient of this award has devoted her time, energy, and talent to the service of others. She has shown a great commitment to the service of others over the course of her undergraduate degree and her time in the Doctor of Physical Therapy program. And I would like to take this moment to highlight just a few of her memorable service activities, though there is much more that I just can't even list today. She has served her community providing service to those in need and the Walsh DPT program. She has served meals and sorted donations for Refuge of Hope in Canton, Ohio. And she's greatly impacted the lives of many people with disabilities, not only on her clinical experiences, but also in her service activities. She's been a buddy for children and teens with disabilities through the FCA All Abilities Camp, as well as assisted individuals with Parkinson's disease through the Delay the Disease and Rock Steady boxing programs. She has helped coordinate a dance and social gathering for adults with developmental disabilities. And for our program, she's volunteered to talk to high school students about our program, and she's also volunteered to be a mock patient. Matthew 5:16 states, "In the same way, let your light shine before others, that they may see your good deeds and glorify your Father in heaven." Allie Brazer, thank you for being a leader in service to others and being a shining light. Please join me in congratulating Allie Brazer as the recipient of the Professional Service Award for your class.
Hello, everyone. I'm Troy, and I'm here to announce the Peer Recognition Award winner. So just to briefly explain what it is to the program. So the recipient of this award is selected through a voting process from their peers. Students were free to vote for any of their classmates whom we recognize as worthy of significant recognition for any or all of the following: leadership, teamwork, dependability, trustworthiness, or all-around likability. And so I'm very honored to announce this because this person has become just a dear friend to me throughout the program. And I also just speak for most of the class when I say this person is one of the hardest working people I know. But outside of just their hard work, they are also extremely caring and selfless. They're always the first person to, in the group chat, say happy holidays to everyone. And they're just a complete light to the class. You make class better. Just like walking in, I always know I'm going to get a firm handshake from this guy. And so, so most of my classmates probably already know who this is just from what I've said. But the winner of this award is Sir Michael Altman.
Before I do the award for our research excellence, I would like to congratulate your entire class on completing your projects and successful dissemination and representing our program so well on the local and regional stage. The Research Excellence Award is given to a student or student group who has demonstrated exceptional productivity with the research process within the evidence-based coursework. Eligibility for this award requires demonstration of mastery of the materials within the research process of the curriculum, completion of a project of distinction within the research series, and demonstration of potential for future scholarship on discovery. The award is nominated initially by research mentors and then voted upon based on your platform presentations that you submitted by faculty. I think it shows a certain level of professionalism and strive for excellence to redo your entire group of statistics 1 week before dissemination, which is hard enough as it is after having to wrangle school-aged children to try and hold still for a few seconds to try and capture their range of motion. And if you have a child, you know how hard that can be. This award goes to the group that was mentored by Dr. Tony Doty. Our group members are Madeline Cantor, Maria Johnson, Kate Rosenthal, Katie Conkle, and Miriam Fetterman for their project Reliability of the Easy Angle Tool for Assessing Knee and Ankle Range of Motion in Elementary School-Aged Children. Congratulations. Dr. Doty, would you like to join your group? Sure. I'm the short one. Okay, let's go. Thanks. Good work. Thanks.
Good afternoon. I'm here to present the Academic Excellence Award. This award is bestowed to the student who has demonstrated consistent academic achievement throughout their curriculum. They're looking at me because I have to do this. Hang on. Nope. Which way do I go? Huh? Okay, let me start over. The Academic Excellence Award is bestowed to the student who has demonstrated consistent academic achievement throughout their curriculum, as evidenced by a superior grade point average and professional behaviors. This student also exemplifies the characteristics of a lifelong learner and is a consistent contributor to positive scholastic experiences. Criteria for the award include excellence in grade point average, demonstration of leadership, recognized potential for continued academic excellence, outstanding professional behaviors. This award is selected by the faculty. The recipient of this year's award goes to an individual that checks all the boxes. So here we go. GPA, it's up there. They've held 2 leadership positions while in our program. They demonstrate potential for continued excellence as evidenced not only by their individual achievements, but in their service towards others. This individual has served as a tutor, as an all-around helper to children with Down syndrome. They've helped clean the clinic when not working with patients during professional experiences, and has also served meals to less fortunate, and the list can go on. In terms of professionalism, this individual can be described as follows. Hailing from the Hoosier state, the term Hoosier, I looked this up, refers to individuals who are brave, intelligent, enterprising, and magnanimous. As a former Blue Streak from John Carroll University, this person, personally, I've never really seen them move very fast, but they get the job done very, very well. And as a soon-to-be former Cavalier, this individual is always a gentleman and extremely polite. From my perspective, he is also a great listener. I'm honored to announce that Bill Magna is the recipient of the Academic Excellence Award.
Okay, so that concludes the awards part of our afternoon, and we are going to move into our induction ceremony. So I know over the past year or so, some students have asked about an induction ceremony to our profession, and we in our program have reserved that to your final day with us. So this afternoon, we will induct our graduates into the physical therapy community through a series of ceremonial events. Graduates will receive a prayer of blessing over their hands, receive a symbolic pin, and have the option to receive an individual blessing of their hands with holy water. And finally, we will recite an oath of a physical therapist with faculty and all physical therapists who are present. So now I welcome Father Trudell, who will proceed over our blessing of the hands.
I'd like to ask all the graduates just to open their hands to receive the blessing. Lord Jesus Christ, look upon these hands which your servants wish to set apart for your service beginning today. May these hands always give a touch which heals. May these hands comfort the distressed and restore quality of life to those who are weak. May these hands give dignity to those who are vulnerable and joy to the elderly. Lord, may these hands always love and never settle for mere duty. May these hands work with compassion and mercy rather than mere politeness and professionalism. And finally, Jesus, we ask you to stretch out your own hands to bless these young people as they begin this new chapter in their lives, that they would always value the things of the Spirit and seek the healing and grace which only you can give. May they always feel your merciful touch, calling them to a deeper relationship with you, who alone can give the peace which the world cannot give. And may the blessing of Almighty God, the Father, and the Son, and the Holy Spirit come down on you and remain with you forever. Amen.
All right, so next on our agenda here is the pinning, which you'll receive a pin for your achievement and transition to the profession. Dr. Larson will hand out the pins, and what we ask you to do is that when I call your name, come on up and approach the front here from the left, receive your pin, and then as an optional blessing, you are welcome to see Father Trudell for more blessing on your hands. If you do not wish to do that, then certainly just continue to proceed on, okay? So we'll kind of take our time with this. Folks, this is a celebration, so anybody wants to come up and take a picture, do so. You know, we're all family here, so don't be shy, all right? And I know Dr. Dunphy will come up and greet you as well, all righty? So we will get on with this. It's, I believe, alphabetical, so as long as I don't go out of order, you know when you're going next, all right? So first student and graduate is, yeah, we're going this way. Counterclock, anyway. Jamie Adams. Do you guys want to clap all at the end or now? Congratulations. Chase Altier. Michael Altman. John Bozelli. Allie Brazer. Chris Byers. Madeline Cantor. Kathleen Conkle. Caitlin Crawford. Mason Eckhart. Miriam Fetterman. Tyler Giesige. Tori Grabowski. Logan Green. Luke Jacobs. Maria Johnson. Katie Kearns. Anna Ligas. You're good. Take your time. Rachel Lowell. Bill Magda. Gabby McAuliffe. Joe Miola. Emily Mercadante. Abby Miller. A lot of beeps. Izzy Miller. Morgan Oldak. Gabriel Overton. Cooper Pastorius. Vani Palima. Stephen Rodonich. Taylor Records. I do this every year. Sorry, John. I'm even marking them off as I go off. My bad. All right. John Noche. Thanks, Taylor. Sorry, John. All right, I think I'm on track now. Kate Rosenthal. Kate Shannon. Danielle Simon. Andrew Simons. Ali Sukowski. All right, did I leave anybody out? We good? Okay, we're good. All right. Let's hear it for the class of 2024. Great job, guys.
You guys did it. Congrats. So at this time, I would like for all of our graduates and any other physical therapists in the room who would like to recite the oath of the physical therapist. There should be some printed out copies at your tables. You may need to share a little. But I would like to invite you all to stand with me and recite the oath. Does everybody have a copy? All right, great. In the presence of my colleagues, friends, family, and teachers, and in view of the honored profession I am entering, I solemnly and willingly state that I dedicate myself to the following. I will practice physical therapy with compassion for the vulnerabilities in each of my patients and will work to preserve their dignity and promote their health and welfare. I will value the lives of my patients as I value my own life through my concern for their significance and with respect for them and the confidential nature of our relationship. I will be humble. I recognize my limitations and will continue to consult with my colleagues and coworkers for knowledge with which I can better treat my patients and for the inspiration to expand and augment my education. I will share my knowledge with my colleagues and patients freely with compassion and patience. I will work toward the improvement of the quality of life for all my patients. I will honor the choices that my patients with respect to their wishes and needs. I will do no harm to another human. I will work to improve the practice of physical therapy so that all who seek it will receive treatment which is proper, ethical, and just. I will not allow my judgment regarding the practice of my profession to be influenced by race, creed, religion, greed, or unethical behavior. I will expect the same behavior from my colleagues and coworkers. Thus, with this oath, I freely accept the obligations and rewards with my practice of physical therapy. Thank you. Let's give it one more round of applause for our graduates.
So that concludes our award ceremony. So at this time, your class of 2024 has put together a slideshow of some memories. So we are going to show that, and all of you can enjoy that. You guys know how to have some fun. And it's just beginning. So that concludes our event this afternoon. We are so proud of all of you. We are excited to celebrate with you on Saturday. You will now be our graduates of Walsh University DPT, but more importantly, you're going to be our colleagues. And so similar to what Ryan said to you is, it's Christine from here on out, right? So thank you so much. It's been an honor and a pleasure to get to know each and every one of you. We are very proud of you. We want you to stay in touch with us, but we want you to go out there and you are returned to your families and your friends, and you can rest your brains for a while. So just two quick announcements. Before you leave, each one of you has a bag over here to my right. Please make sure that you pick that up before you leave. On Saturday, we will be, one last email from us, well, maybe two, but we will be sending you some of the photos from that were taken today. Those will be available to you. We will make sure that you can have those after Saturday. Next week, you may get an email from me just once your transcripts are released. I know many of you are waiting for that day, so we are excited to have you join us in the profession of physical therapy. So I'm just going to close with a prayer. May the road rise up to meet you. May the wind always be at your back. May the sun shine warm upon your face. And until we meet again, may God hold you in the palm of your hand. So good luck to you. God bless.